Shubham, hello.
Yes, sir. Tell me.
Can you make Dr. Tripti Adiga co-host?
ग्रुप में ठीक है. So kindly ask members to join now. Dr. Shilpa has not joined yet.
Yeah, she said she will join now. I had called her.
Hmm. I request all the members to join the meeting with your own name only. Kindly rename your name if it is not your name. I could see there are members joined the meeting with name Oppo A5 with some phone numbers. Kindly join the meeting with your own name or college code or college name. Google Pixel 7 Pro, iPhone, TSC, Samsung. We have to remove those members if anyone is having some other name and join the meeting. Dr. Shilpa, you are co-host now. Kindly share your screen and check it once.
Okay, sir. Sir, is it visible?
No, ma'am, it is not.
Sir? Sir?
I'll share that what I had written to you also.
Okay, sir.
Okay.
Ma'am, it is not, matlab, screen is not visible.
ಕಾಣಿಸ್ತಾ madam.
Anything.
Okay, sir.
Madam, PPT can be displayed. We are seeing your window only.
अच्छा,
Shilpa madam?
ma'am, screen is visible. You have to
Share the
go to your
slides.
PPT and share it.
Windows. Windows.
Windows.
Open ಇದು click ಮಾಡಿ.
ಈ ಸಲದ ಕ್ರೋಮ್ ಟ್ಯಾಬ್ನಾಗೆ ಹೋಗಿತ್ತಲ್ಲ ಅವಾಗ ಸೇಮ್
Good afternoon, everyone.
ನಾವು ಶೇರ್ ಸರ್ ನಾವು
Now it's visible.
ಓಕೆ ಸರ್
You just change the slide. Let's see whether the slides are getting changed or not.
ಸರ್ sir, I think it's the scrolling, it is coming.
No, you put in slide show mode, madam.
Okay. Slide, open the slides.
Now, if it is okay for you with this mode, then you can continue.
Google Slides I shall show, sir.
No, I don't think it will be.
Open it.
You can make it to slideshow if it is possible.
Or else, Shubham, can you do it on your end? Slide sharing?
Sir, I don't have that.
No, she will send you.
Okay.
Madam, you do one thing. You send him, Dr. Shubham, once.
Sir, is it okay, sir? If I like do it, no?
Okay,
Like,
okay.
scroll, it will be like comfortable for me one by one.
Madam,
Fine,
if you
fine.
are
Okay.
scrolling, madam, if you are scrolling, just zoom it little bit.
Okay.
Okay.
Control here.
Just
Madam. Control plus zoom to one second, but mouse button.
is it okay, ma'am?
This is okay.
Okay, sir. Okay.
Control is scroll ಮಾಡಬಹುದು.
Okay.
Control is scroll ಮಾಡಬಹುದು.
For some time, you can stop sharing, madam.
Okay, this one, sir.
Unshare the screen so that we begin the program.
Shall
Now-
we start, sir?
President sir has joined.
Yes.
Atul sir is also there. Yes, we can start. Tripti madam.
I request the to initiate.
ಇದು ಅದಕ್ಕೆ ಇದು ಕ್ಲೋಸ್
ಇದು ಕ್ಲೋಸರ್ ಸರ್ ಹೋಗ್ಬಿಡ್ತೀವಿ
ನೋಡ್
ಹೋಗ್ಬಿಡ್ತೀವಿ ಸರ್
ಹೋಗ್ಬಿಡ್ತಾನೆ ಅದನ್ನ ಮೀಟಿಂಗ್
ಮೀಟಿಂಗ್ ಇಲ್ಲ ಸರ್
ಮೀಟಿಂಗ್
Dr. Tripti.
Tripti madam, you can start the program.
Can you hear me, sir?
Yes, we can hear you.
Okay. So,
ಅಲೋ
Bhagavate Namaha. Good afternoon to all. Today we have joined second day of faculty development program. We have session 3 and session 4 today. That is 22/4/2026. I once again welcome all the respected officials of NCISM and all participants for this program. I wholeheartedly welcome today's guest speakers. So we have two sessions today. Our eminent speakers are Dr. Shilpa S. Raga ma'am, Professor, SHES Ayurveda Medical College, Kalburgi, Dr. Prajna R. Kapse, Assistant Professor, RA Podar Ayurveda Medical College, Mumbai. So now, before beginning our actual sessions, let us welcome Dr. Atul Varshney sir, Member, Board of Ayurveda, NCISM, for the opening remarks. Over to you, sir.
Thank you, Dr. Tripti. आदरणीय चेयरपर्सन मैडम, प्रेसिडेंट महोदय, डिस्टिंग्विश्ड स्पीकर्स और सभी सम्मानित फैकल्टी मेंबर्स और यहाँ जुड़े हुए सभी सम्मानित प्रतिभागी, आप सभी लोगों को मेरा सप्रेम सादर नमस्कार। सबसे पहले तो मैं इस कार्यक्रम के शुरुआत के लिए हमारे जो पूरा खाका बना कॉम्पिटेंसी बेस्ड डायनामिक क्यूरिकुलम का, उसके लिए हमारे पूर्व चेयरमैन डॉक्टर जयंत देव पुजारी जी और हमारे पूर्व अध्यक्ष डॉक्टर बी एस प्रसाद सर का भी आभारी हूँ, जो उन्होंने बहुत एक अच्छा इनिशिएटिव सबसे पहले शुरू किया था 2021 से, और उन्हीं की प्रेरणा से, उन्हीं के प्रयासों से तीनों प्रॉप के वो जो क्यूरिकुलम है वो तैयार हुआ, और सभी फैकल्टी और सभी स्टूडेंट द्वारा उन सभी जो हमारा सिलेबस था उसका अच्छा स्वागत किया गया। और जो उसमें कठिनाइयां आ रही थी उसको समझने में, उसको लागू करने में, तो उसके लिए भी हमारे जो नए चेयरपर्सन मैडम मनीषा जी और हमारे नए प्रेसिडेंट अलम प्रभु गुड्डा जी ने उनको समझा, और एक फैकल्टी डेवलपमेंट प्रोग्राम के लिए हम लोगों ने शुरुआत किया। और उसी की श्रृंखला में कल हम लोगों ने जो पहला कार्यक्रम आयोजित किया, आज दूसरा कार्यक्रम है। मैं समझता हूं कि इससे हमारे सभी लोगों को बहुत लाभ हुआ है और आगे होगा। आज का समय ट्रांसफॉर्मेशन का समय है, स्पेशली मेडिकल एजुकेशन में। अब सिर्फ नॉलेज देना है ऐसा अपर्याप्त नहीं है, बल्कि स्टूडेंट्स को कॉम्पिटेंट, स्किल्ड और पेशेंट सेंट्रिक प्रोफेशनल बनाना है। इसी विजन को ध्यान में रखते हुए कॉम्पिटेंसी बेस्ड डायनामिक क्यूरिकुलम बनाया गया। लेकिन क्यूरिकुलम चेंज अपने आप में पर्याप्त नहीं होता है। रियल चेंज हैपेंस इन द क्लासरूम, और उस चेंज के सबसे महत्वपूर्ण कैटलिस्ट आप सभी टीचर्स हैं। यही कारण है कि यह एफडीपी युक्ति डिजाइन किया गया है, जिससे हम अपने टीचिंग मेथोडोलॉजी को और अपग्रेड कर सकें, असेसमेंट टेक्निक्स को और इम्प्रूव कर सकें, और एजुकेशन को मोर इंटरेक्टिव, आउटकम ओरिएंटेड और इफेक्टिव बना सकें। शिक्षक केवल सब्जेक्ट एक्सपर्ट नहीं होता है, वह एक मेंटर, एक गाइड और कई बार एक रोल मॉडल होता है। इसलिए कंटिन्यूअस लर्निंग हमारे प्रोफेशनल का एक हिस्सा है। इस प्रोग्राम के दौरान आप मेडिकल एजुकेशन प्रिंसिपल्स को रिविजिट करेंगे, टीचिंग लर्निंग मेथड्स को प्रैक्टिकली समझेंगे और असेसमेंट स्ट्रेटजी को और इफेक्टिवली लागू करना सीखेंगे। और सबसे इम्पोर्टेंट है, आप अपने एक्सपीरियंस शेयर करेंगे, जो इस लर्निंग को और भी ज्यादा मीनिंगफुल बनाएगा। मैं विशेष रूप से ये एम्फेसाइज करना चाहूंगा कि सीबीडीसी इज नॉट जस्ट ए क्यूरिकुलम चेंज, इट इज ए माइंडसेट चेंज, और हमें यह टीचर सेंटर्ड अप्रोच से लर्नर सेंटर्ड अप्रोच की ओर बढ़ाता है। इसलिए मैं आप सभी से यह आग्रह करता हूं कि इसमें जितनी आपकी इम्प्रूवमेंट होगी, जितनी आपकी इन्वॉल्वमेंट होगी, यह प्रोग्राम उतना ही इम्पैक्टफुल होगा। मैं सभी लोगों से अनुरोध करूंगा कि बहुत ध्यान से इसको सुने और अपने विचार आगे हम लोगों को बताएं। धन्यवाद।
Thank you so much, sir, for sharing your experience and this opening remarks for today's sessions. Now, I would like to call Dr. Allama Prabhu Gudda, sir, President, Board of Ayurveda, NCISM, to share few words on this occasion.
Thank you very much, madam. Today also you have started in right time. And yesterday I have seen in a Zoom meeting 1,000 teachers, and in YouTube it's around 6,000 teachers. It's a very good number, and the number itself shows it's a grand success program. That is one thing. And second is that teachers should not feel that ये एक मैकेनिकल रहेगा, इसमें सिर्फ हम टेक्नोलॉजी यूज करके स्टूडेंट्स में कुछ परिवर्तन लाते हैं, ऐसा नहीं है। एक छोटा सा एग्जांपल है, वंस ए टीचर थॉट दैट सिलेबस वही रहेगा, क्वेश्चंस वही रहेगा, तो इसीलिए मुझे हर वक्त क्लास में जाकर क्या पढ़ाने का है। तो उन्होंने एक रास्ता ढूंढा कि एक टेप रिकॉर्डर में सिलेबस का रिकॉर्ड किया और क्लास में जाके रख दिया। ऐसा ही 2-3 बार किया। तो एक दिन उनके मन में आया कि मैं टेप रिकॉर्डर क्लास में रख के आ रहा हूँ, तो क्लास में क्या चल रहा है मैं थोड़ा देख के आता हूँ। when he entered the classroom, ना वहाँ कोई भी स्टूडेंट नहीं थे, सभी स्टूडेंट्स भी एक एक टेप रिकॉर्डर डेस्क में रखे थे। तो इसलिए क्या है, गुरुमुखे ना टीचर्स और स्टूडेंट्स का इंटरेक्शन होना चाहिए, और ये एक है। और दूसरा, हम आयुर्वेद परमादर शब्द यूज करते, तो परमादर जो है पाठ अवबोध अनुष्ठान तीनों एंगल में रहना चाहिए। सो ये सभी विषय है। कल दोनों लेक्चर्स ने बहुत अच्छा किया। आई होप टुडे 2 speakers were there. I expect the same from them. And one more thing is, yesterday number of teachers were demanded that जो PPT presentation आज किया है उनको शेयर करना चाहिए, वो टेक्निकल पार्ट है, and we will do that also. So thank you very much, and over to you. Thank you.
Thank you so much, sir. So with this, we will move on to our first session. The first session is Teaching Learning Methods for ASUS Education by Dr. Shilpa S. Raga ma'am. So we have a small intro for Dr. Shilpa S. Raga ma'am. So she is an expert member of All India Ayurveda Panchakarma Syllabus Framing Committee by NCISM. Pursuing her PhD, many additional qualifications on Nadi Pariksha, cosmetology, yoga, etc. She has presented her papers in many national, international seminars, and she has published articles too. She has delivered many guest lectures, including mini symposium in Ayurveda illness to wellness held at Croatia, Europe. She has won best paper presentations awards in many seminars. Now let us listen to her talk. Over to you, ma'am.
Thank you. Hope it is visible.
It's visible, ma'am.
It's visible now, sir.
Yes, yes. Make it to slideshow if it is possible.
Sir, is it okay?
Yes, yes, ma'am.
Okay.
Slides are moving. You can start.
Okay. I will, first of all, my sincere gratitude to Dr. Alam Prabhu Gudda sir, President Board of Ayurveda, who has given me this opportunity to deliver my the knowledge which we have and we are practicing. And my sincere thanks to Dr. Anand Katti sir, who has throughoutly coordinated, and he also and very well initiated us to do the things. So with the blessings of Dhanvantari, I would like to present today's teaching learning methods for ASUS education. So coming to the importance, I think many of the teachers, we are having these questions with us. So if I ask to a teacher whether teaching is a challenging, then many of the teachers who has gathered here, some of may agree for this, but some of the teachers, they are disagree, because teaching is not a challenging for those teachers who have a very smooth and very communicable skills with them, and they always give a good in communication, good express their knowledge in a proper way. But for the teachers who have a knowledge but still unable to express their views about the subject and all, it is a challenging for them. For those teachers, definitely the expressing the knowledge is very challenging. Vice versa, if we go to the students and if we ask to the students, learning is a difficult for them. Obviously there are some students, they says that it is difficult a learning process. But toppers are the intellectual who has a very critical analytical mind. Such students never says that it is a very difficult task. Why? Because they have their like in complete rehearsal, whatever they learn they make it in the completely day-to-day works, and they feel and they have a critical analysis in their mind, and they communicate with the other things, and they come to some conclusion for their subject and for that knowledge. So they never feel learning is a difficult. But for the other students, definitely learning is a difficult task. Now what is the thing why we are learning today the teaching learning methods for all these fraternities? Because we are unable making our students to learn is a biggest task. We feel as a teachers, we feel that it's a biggest task to make our students understand what the concepts we are like wanted to share with them. So why what this teaching learning methods helps? It is a bridging process between the teacher and the learners. So if we have used the proper teaching learning methods, then definitely we can connect with our students in a better way. So for that purpose, we are today I'm going to express some of the like teaching learning methods, how they are more impact to make our teaching process more better. So to make this better, what we have to do as a teacher? Know your students' demands in the classroom to learn the subjects. It's important to know your students' demands to ensure the effective learning. There is in some era before the students never used to be like or ask the teacher anything. But nowadays if you see the primary education and the higher primary education, and in the like an intern and in the class 11 and class 12, they all are teaching the students in the CBDC, that is a competency based education they are getting. But when it comes to the like in Ayurveda, the other sciences like in modern science like in MBBS and all, still they were having in competency based teaching itself. So it is very easy for those students who are opting the MBBS and dental and all. So they were like in growing day by day. So what happened in an Ayurveda, when the students lively we have seen in our college, the students who have got in the second term like in the 12th class and all, they have scored 85 marks, 90% and all. But still when they come to a BAMS first year, they are not able to like can qualify the exams at all. This is because the traditional way of the teaching what they were getting, the traditional way of the teaching is an excellent teaching, I agree for that. But in the same way, the present generation of the student what they are getting their basic education in the form, that form is discontinuing when they are adopting the Ayurveda as a their professional. So I feel that this change in the syllabus is the appreciating step for the next level of the teaching to Ayurvedic students. So for that, what we have to do is we should know the present student, the present generation, which form they wanted to learn the things, because we can't throw our ideas in them, we can communicate in a proper way. So for that reason what I feel, all the teachers we should know the respective subject, respective demands what the students wanted to learn, and we wanted to ensure the effective learning the students are getting. For that purpose, the teaching learning methods are the most important tool we should learn to make our teaching efficient and to make our students to get the better acquisitive of the knowledge. Coming to the aims and objectives. So what is the method which we are using? What's its aim? So the aim of all these change in the syllabus is to facilitate effective knowledge acquisition in our students, and to develop some of the skills the in a respective subjects, and even more important behavioral change by aligning the instruction with the student needs. So it is very important aim which we have with this change in the syllabus. And the second aim is to cultivate the capacity for independent thought, problem solving, and reflective judgment. So with this aim, we have to learn this proper teaching and learning tools. So I will feel like the four objectives are the major objectives for the present syllabus. The teacher should adopt it. So conditioning, which helps to improve the learning skills of the students. So conditioning means it is the like in training the students with the proper like equipments and the procedures, and we have to make the skills. Like we have a chikitsa chatushpadas, like bhishaka, dravya, upastha, and rogi. So here a bhishaka, he should have it four again the pillars, like in four again qualities: daksha, stitartha, shastrartha, and dushta karma. This to dushta karma, daksha, this all comes under the like a learning processes. So shastrartha is also a passive kind of a learning, we need it. So the fourth fold of the teaching is very important to make a person or a student to be a best doctor. For that purpose, conditioning is very important to improve the skills in the student and to improve the shaping behavior and the conduct. It can be achieved by the proper training. Proper training is we can teach them what to do, what not to do, and how to study. All these things helps. And to gain the knowledge in the students, we can instruct them, that is a guiding. So we should be the guiding stars for them. What is the best knowledge, what is the best way to gain the knowledge to the students, and the empower the formation of the belief in the students can be achieved with the indoctrination. So it is the indoctrination is the way of the teaching to the small group of the students, how to believe, how to increase their self confidence in them to achieve the critical skills. So with this objective, let us move to the types of the teaching methods. So making not much complicated the things, I wanted to like and simplify the things, and how to adopt those teaching learning methods for the day to day, like and to run the academic sections as well as a approach to the students to learn better things. So teaching methods are not, it is a technique. What I feel, it is a technique for the educators to use or to facilitate the learning process. So there are the two ways we can reach this goal. With one teaching tool is teacher centered approaches, and the second one is student centered approaches. The teacher centered approach is in traditional way of the classes which we are conducting, like in LH, learning hours. So learning lectures, they comes under the traditional way and all, but the student centered approaches are the active learnings. So now the what the CBDC syllabus has made, it is a student centered approaches because of the change in the generation, and the gaining the way of the knowledge is different for this generation. That's why nowadays the syllabus should be the student centered approaches. So that's why the syllabus has framed, which is if we adopt it, it is very easy. So let us see one by one what it is. So different teaching learning methods we have in our syllabus. Like what are the different kinds of the things for the particular subject topics we have added in the syllabus, aligning with the Bloom's taxonomy and the Miller's pyramid, and course outcome and program outcome. Yesterday we have gone through all the such things. So today I will limit it my presentation to the teaching learning methods. So in that, the teacher centered methods are three methods. They are the lectures, demonstration, and direct instructions. Some of the student centered examples are the project based learning, inquiry based learning, flipped classroom, collaboratives. The other active learnings, like a specific types, we have a role play, case based learning, kinesthetic learning, scenario based learning, game based learnings, and some others are very important. They are also help for the learning process, like quiz, brainstorming, small group instructions, technical enhance, integrative approach, and the hybrid learnings. So when we come to the first, that is in teacher centered learnings, that is passive learning, we call it as a passive learning. So what we are nowadays, we are feeling passive learning is a very boring kind of a learning. Even as students, when we go to the class, no, when we say that today we have a LH, this is it's a very like in monotonous. So they feel sleepy, they don't feel like to be active in the class because it is not able, their concentration is not that kind. They wanted something in a different manner. So we always have a picture, that's why I have kept this picture. we ourselves as a teacher, we are not active. Sometimes we feel, oh, okay, lecture hours, it is very like I have to teach for 1 hour and all. So I feel the passive learning is most equally important as active learnings, because the passive learning is the base for the active learning. So without the passive learning, we can't directly go for the active learnings. So let us see with some examples of the passive learnings, how it is having a good impact and why it is needed also. So direct instructions. Direct instruction is a one of the very good, like in traditional teaching, that is a class teaching. In the direct instruction model, students do not learn through the discovery. Instead, the knowledge is told directly to the student. Yes, of course, when we enter to the class, 1 hour, we will deal with the topic and we will just explain it, whatever like the related to the topics. That time, there is a no chance to the student to discover it. And we need, there are some topics in Ayurveda that is always deal with the direct instruction itself. We can't make it as a practical also. So example here is air hostess guidelines. See, when we are going to, when we were traveling, no, that time we travel, then air hostess, she, whenever the aeroplane is a takeoff, that time what it will, the air hostess, she gives some guidelines that you have to put your seat belts, and you have to carry your oxygen masks. If something, anything in the aeroplane, she will guide us. And that time we will not ask, or we will not do any discovery, or we will not do any analysis in the return. That time we obey the things. In the same way, in Ayurveda also, when you come to the Tridosha Siddhanta, then when we were explaining in the class, that should be a monotonous itself. They have to learn it, that the doshas are three. Obviously, according to Shushruta, that is a Chaturtha dosha. But here, as a reference and example, the three doshas, Sapta Dhatus, here, when we were telling three malas and all, it is a direct instructions. It is needed. We have to tell the students that there is no chance of discovery. There is no need of discovery also. What is, why only the three doshas? Why Sapta Dhatus? Why not eighth dhatu? That is an analytical, that is a different one. But first you have to pass the direct instruction class, then only the student will start some active learning process later. Then they will analyze, oh, okay, this is the three only doshas, why not 4, 5, 6, like this. So but the direct instructions are needed for some topics, and we have to adopt this direct instruction method also for our teaching for some of the topics. The second one is the very important one, that is a television method. When we watch the television, we learn the things. In fact, much of the children's early vocabulary is observed through the television. Nowadays, if you see from the childhood after the birth, the generation is exposed to the technologies, and whatever they learn, it will more impact to them rather than other mode of the teaching. To see it, it has a powerful passive approach nowadays. It is actually a passive approach, passive learning, but still it is having a more impact. So for example, if we see mortality rate of a COVID-19 pandemic, so we, the world has like the pandemic, like an anxiety and all, we have seen in the television news channels and all. There is, we have not referred any books or nothing. So we were updating in the television itself, and all the students and all, everyone, they were updating in the news channels. So it is a very powerful media. Even we can give some important, like in television talks and all on the things, so we can give that to the students. And even in an Ayurveda, when it comes the research developments in the Ayush, so the things, the research developments in the Ayush ministry and the steps taken by the NCISM and all, international level, national level, everything is in the media level. So if the students are exposed to such kind of the things, if they are seeing all those things, it is also one of the powerful media. It is impacting on the students. Next is modeled instruction. Modeled instruction, the best example is the remedial classes which we are taking in the colleges. It is also one kind of an passive learning object. So is a form of a teaching. What is the moduled instruction teaching? Is a form of a teaching that involves only a teacher or an expert showing the steps involved in the how to do something, because all students are not like the students who are not getting in actively learning. Then we have some of the modular like in class remedial classes for them after their formative exams and all, if we are feeling that the students are not getting up to the marks. So these remedial classes will help them. So it is a passive kind of a learning, it is not active. It can also come in a handy when a task is interesting but too difficult for untrained students to do themselves. That's why the remedial classes will be not conducting for the freshers. Once they have exposed to that subject, when they have some difficulties, then we are planning them for the remedial classes. So that is the modeled instruction teaching only we call. So for example, we have to make it little interesting. That time students will not come to know any of the part related to that topic. Here, the best example I can tell you is showing a fire safety measures by a fireman. If you tell some students to go and see the fire safety like in measures, how the fireman has like in giving, it is interesting for the students, but they don't know the depth knowledge of the such things, how to open, how to handle, and what are the force and all these things should be needed, what is the strength we have to acquire. Such things will be not with the students, but still they enjoy their learning. They see that the fireman is doing something the very interesting and I am learning. So in the same way, even our teachers, when we are like in explaining the procedures without any observations, and then it is very difficult. If we have to make something interesting to learn them, then they will go to the depth later. So it will be like in show, that is the fireman show. So that's why we have to do the procedures and all. If we want, we can change some of the teaching methods with some observation, then we have to expose them to the procedures. So the another kind of the like in passive is podcast. It is a very now a trending one. It is an easily adoptable passive learning method. What I feel in the regular, that is a podcast is a recording that people download to their personal mobile devices to listen to in their own time. It is in asynchronous, so it is the only one way they can listen. They can't like react or they can't ask some like in doubts to the speaker, but it is a monotonous, that is asynchronous we can call, which means the listener cannot communicate with the speaker. The recording is of course not a live. So here, so clearly many people find this form of a passive learning is very useful and effective, and we use this also. See, if you have some of the podcast means some recordings we can send to the students, like in for example, if you see in the Dravya Guna, we have a Mahakashayas and all the 50 Mahakashayas. So when we were students, that time we used to make a songs for the all Mahakashayas. So we used to be like record it and we used to listen it repeatedly. So to understand, for example, till today we remember what is the Varne Dravyas. So Varne Dashimanis. So easily I can remember after the 12 or 13 years also. Chandanakeshara Padmaka, Ushira Madhuka, Manchista Sariva Payasa, Sita. So we have kept a ad of a Santur to it, and we made a rhythmical remembering of those things. So the way of teaching, even in those days we used to be learn these things by our teachers. And today also the same thing, if we make these things, now every year we can send to the every batches some of the recordings and they can remember it, some of the shlokas in the rhythmical manner. If you had the important shlokas, you can do it as a form of the like an you make it a recording and send into the subjective group. If you have your respective subject group, the students will listen those things and they remember, because it is a very effective things. So practically we also practice the such things. We send some recordings and all, we will tell the students to see the recording, hear the things properly, and then in the next class they can come with those things, like in shlokas also you can put some of the important like in things. If you wanted to share with the student, you can make a recording and send it to the group. So it is the very important time consuming, so everything can't be covered in a 1 hour like an LH hour or 2 hours in a NLHT or NLHP. So some of the other modification we have to for the particular topics in a particular subjects. It will help for us to consume the time and to deliver the more good knowledge to the students. Other than that, the most effective and nowadays the trending one is YouTube. They are a free. It is also a passive learning. We can't tell it is an active learning. It is a passive learning because there is the only a person can visualize. There is no reaction or there is no any doubt clearing. So YouTube, they are a free and it is an amazingly accessible way of a learning just about any topic, whatever topic we want, we can assess it. While it is a hard to actively learn through the YouTube, viewers do have some freedoms. So see, whenever they want, they can use it. See, they can pause it, they can slow it. If they have some like in work, they can pause, they can slow, or if they are not understanding, they can rewind it the videos and learn at their own pace. So it is very important that YouTube, like if we have in our class, if there is some like in Panchakarma, as I am a Panchakarma professor, so if any procedures, if we are unable to like and show, we can make that the procedure video link or any surgical operative links, if you share in the group, the because in all the colleges we are not having the complete exposure of all the like in things, like all the surgeries which is there in the syllabus, we can't like in live demonstration we can't show to the students. So some of the like in procedures, some surgical procedures you can share, which is easy to understand for the students in the group as a form of a links. So YouTube links you can send, so they will learn how the surgical things are done. So it is a very effective, what I feel, as a passive learning we can use. Coming to the books, I feel nowadays it is an completely outdated students will think. So I think it is a duty of a teacher. We have to keep the connection of our Ayurvedic student with our samhitas and our textbooks, because books are the packed with the gems of the information. With libraries, we can freely access the amazing amounts of the information to learn just about the anything we want. But still it is the textbook books are considered as the classic learning book in a classrooms. The students are not ready. If we tell something, they take their mobiles and they start searching, because everything is ready in the Google. So it is very and it is nowadays it is very commonly criticized as a 20th century passive approach to learning. So if we tell the students that go and search the books and all, this is no ma'am, we have everything in the like in Google, otherwise YouTube and all. So they feel it is a 20th century's passive approach. It is not. Nowadays we don't want it to learn with the textbook. They are as a well being slowly phased out of the contemporary classroom. So nowadays it is slowly phased out from the classes. But what a teacher can do is, if you wanted to keep touch with the students with the samhitas or the respective textbooks, then then we can give a assignment or the projects to the student to refer the particular topic and to make a project of that topic in a year, so that it can be a not a student task, it is a group student task. One student will never go and search the book. So what we can do, we can make a group of students, where in a group one student should be a more active, another two students, like in Vata Pitta Kapha groups you can prepare. So if you know in this manner, if we do that, definitely that group will make some good things and some good projects with these referring these textbooks, and we can make this like outfaced contemporary classrooms textbooks, we can make it the part of our education as well. So I feel give some projects with the like in samhitas and all. And if you want, you make some of the like in Panchakarma, we tell the students to like in make like in Virechana. It is like Tamaketu Virechana. We give some like why it is important. Go and read the classics. Why it is like this. It has quoted. Make a one project, small project, and come with that project. What is the other authors has given on this topic. So the group of the students will go and they make some of the things, and they come with the small project to us, and they tell, ma'am, in this book these are the reference are there, again this. So the doubts will clear, the depth of the knowledge of the student will improve, and they start thinking analytically. So I feel they give some of the books as a project. And the most important thing is observational learning. It was proven as a very powerful by the Albert Bandura in the 20th century. So if you see the scientist in the 20th century, what he did an experiment with the with the adults and the childrens. So what he did, he took a bobo doll and he made it two groups. Like one adult group, they have like can dealt with the students, especially for the childrens. They were observing the group of the adults who are dealing with that doll, and the another group there, the doll was treated by the other adults, and the two groups are different. And one group, if you see, the adults, they were like hitting the doll, they were like squeezing the doll, and they were making some of the like in harmful activities with the doll. And the students who are observing them, they have cultivated the same things. And in the other way, when you see the other group, they were the adults were very kind, loving, caring to the dolls, and the children who are observing that, they have grown with the very kindness, loving nature and all. So it is similar to when we were like an youngers, like in childs, we our parents used to tell like a parrot, like in stories to us. Why? Because they wanted to cultivate some good things in us. Similar way, that is an observational, how the observational teaching is, learning is more important for the students. So what with this experiment, the Bandura has concluded that the children learn through observation of a adult modeling. So what we do know, the same thing they will like, and it is a social learning theory we can call. So how the scenario we create, in the atmosphere we create in our in around our like in premises, the same things the students will observe, and they feel it is an important, I have to study and I have to do it. So it is an observational learning is in Panchakarma. What we do, we send the students to just observe the procedures, how the therapists are doing. After the practical classes, we expose them for the observational classes. We keep morning 7 to 8:30, there is a practical classes to them. So that time they have to see that how the things are going, just a observation. The team, the group of the students will go and they observe. So if any doubts in our teaching and their performing, then they will come and ask, ma'am, these are the differences we have found when the people, the therapists were doing these kind of the things. So we tell that there is a mistake, that is should not be done. If it is the proper, then we will understand, make them that the steps are the important as a purva pradhana, so they follow all these things. So like this, the observational study is also important with respect to the subject, we can adopt it. So coming to the lecture method merits. So what is the lecture methods merits? As I told, the lecture, it is an like an very time saving one, because and we can gather the complete whole population. Like here, the if it is the students are 60, 100,000, a lecture method can easily convey their ideas to the mass. So it is in a short time. So this is a very important merit of a lecture class, and it is very convenient in handling a large group of the class, and it is easily fit in when introducing a new concept or a topic. So anything which is a new and anything which is a newly starting, the lecture will be the first passive learning for the students. It can be easily be used in a cases where the relevant teaching and learning materials are rare to resources. So what are the demerits of the lecture methods? Does not enhance the understanding in learning. It encourages the rote learning. So it is very difficult. It will not enhance the understanding. It is because it is a monotonous. When we are telling, so it is difficult for the student to get encouragement. It is difficult to sustain the attention of a student using the lecture method, because on a 5 minutes or 10 minutes attention we can gather the students. For 1 hour to gather the students attention, it is very difficult with the lectures method. It does not provide the appropriate room for our lectures to monitor the student progress. Yeah, of course, the progress and things should be monitored in the lecture hours is very difficult, which we can do with the active learning and making some checklists with the respective like in activities and all. It can be easily possible with the active learnings, but in the passive learnings like lecture methods, the monitoring the student progress is very difficult to do it. It does not encourage the active student participation, makes the learning passive along with the teaching to do all the work. So it is difficult. It never ever encourages the students to become active. So what we can create some attention while treating with some of the active learnings in such topics when we were dealing. So coming to the active learning. So we finished with the passive learnings. Now it is an active learning. So what is an active learning? Active learning is a doctor or a student, they gather or they learn the things with the new, they get the new information from the classes and some other things. And what they do when they get the new information they learn, then they start the schematic presentation in their mind. So they form some in their own way, they form some schematic presentation. Then what they start finding the additional informations and all, and they take that additional information in the form of elaboration, generation and reflection. These three together is known as an active learning. With these active learning, once the additional information they found, they come to some conclusion that okay, this is the reason for this particular condition to happen, so this is the outcome of that cause. So that schematic presentation will come into the scheme modification and enhancement, that is the complete retention of that knowledge. So this is called an active learning process. So at the end they will retain that knowledge. Otherwise what happens if they are not mingling with the active learnings, here some things they will not get to retain the knowledge. So let us understand this active learning with one example. So Acharya, Adi Shankaracharya has given the teaching like in Jnana Sadhana, Jnana Yoga Sadhana. He said that Shravana, Manana, Nididhyasa. Shravana means listening. The things which we wanted to. Jnana Sadhanas, three ways he has explained. Like Shravana, we should listen it properly. Whatever the information we are getting, we should gather it. Then what we have to do? We have to do the manana. Manana means we have to elaborate what are the things we have got to know. We have to elaborate it. We have to meditate it, and we have to like come to some conclusion. That is called as a nididhyasa. Nididhyasa is come to conclusion and confirm the knowledge in a deeper way. That is called as a nididhyasa. So in the education field we can adopt these things. So that is this Shravana Manana Nididhyasa form of education itself is an active learning process. So let us understand with the COVID-19 this one example. See, when a doctor or a students in the as a doctor, when they were approached to the COVID-19 severe conditions like in hypoxia, that is low blood oxygen saturation and severe respiratory acidosis. So this is the observation, that is the approach or the learning to a student. Then what they will do, they will start thinking why there is an hypoxia, what it made to come to this conclusion, where the pathology has happened, how the pathology has formed. All the things comes under the manana, that is elaboration. That is they will start digging the things, they enter to the deeper level of the subject, and they will come to the conclusion by seeing the physiology and pathology in the disease, like increased dead space due to the endothelial inflammation and the microthrombi. There may be a lack of the blood supply and increased diffusion barrier due to alveolitis and pulmonary edema. There is no blood supply to that condition. That's why the patients will land into the hypoxic state. So what is the conclusion with these kind of and deeper elaboration? They come that greater refining of a schemas and better retention of a concepts. So they will come to know that why this hypoxia has taken place in a COVID-19 conditions, that is pandemic condition in that disease. So these are the physiology, these are the pathologies will takes place, these are the causative factors, how the virus is like an incult in the blood, and what are the treatment remedies we have to do to break this pathology. So that is called as an active learning process. So there are the some things which we are like in active learning processes which we are practicing in our like in after the syllabus framing in the department. That is a small group teaching. It is a really very effective one. Here especially we make a group of the students before making them to discuss what we do, we make a small groups, and each group will come to us, and that group we will give some basic knowledge. Like for example, here in this we have made a 4 groups. In this group, we given a Rakta Mokshana. That is a Rakta, importance of Rakta Mokshana in Vata Rakta. It is a NLHT process. So, importance of Rakta Mokshana in a Vata Rakta, importance of Rakta Mokshana in a Ekakushta, importance of a Rakta Mokshana in a, some other diseases like this. And the students has made a group. In this group also, again subgroups we have made. Like in the 4 students will present the Nidanas, 4 students will present the, after discussing the Lakshanas, 4 students explain the examination and the blood investigation, and the one group will tell the chikitsas, what we can plan for them. So like this, the students, the group discussion will come to a conclusion, and they will come and they start presenting themselves for the better. If any corrections for that, it is important, we can make a corrections in the that place, and it will help them to like and understand the diseases in a deeper way. And then they will expose to the some of the activities, and they learn it, they will retain some knowledge in this activity. So I feel some of the NLHT and all, like an activities, we can take a small group teaching, because an individual teaching is not possible in a UG colleges, because for a PGs we can give an individual task, but for 60 students, 100 intake students, it is very difficult for us to give an individual task to the students and to monitor it, and later the part is assessment. So it is very difficult. So better we have to make a small group teaching. It is more effective, as well as see in the picture also you can see, when I said that do some group activities, no small groups, the respective diseases we have given, immediately students took their mobiles and they started searching the things and all. But later what thing I have made, I made the student that make a small project of your topic, not on the mobile. You have to write the references of the Vata Rakta from the textbook, and you have to write the all the like in each group should be like, see what are the investigations and return everything in the books. You have to write the references of the book and you submit your project. So then they have submitted. So this is an initial method, like they have exposed to the group discussion, later they went, they attached to their samhitas and took, they return in the all the references of all the diseases, treatment plans explained by the different acharyas and all, they submitted to the department. So I feel small group teaching is the more effective one. Coming to the demonstration, it is the procedure demonstrations. What we can do, it's a very important demonstration. We demonstrate all the students. It is also one type of an active learning process. So in here we demonstrate all the panchakarma procedures and all the step by step SOP, standard operating procedures, to the students, like what are the measures we have to take, and what are the panchakarmas, like the adverse reaction can happen, what measures, precautions we have to take during the treatment and all, and how the drugs should be selected for what purposes, how to see examination and all, to plan some panchakarma treatment. So these are the demonstration type of an active learning teaching. Coming to the bedside teaching. So here bedside teaching, see all the students in the second phase itself, they have knowledge of the history taking, and they know the prakriti assessment in the first phase and all. So in the final year, when they come to the students, especially so in bedside teaching, we will tell the students, we can tell them to go to the student patient, and they can, and we have to observe how the students are taking the bedside cases and all. So in the first picture, you can see that they were taking a case of a patient in a bedside, and they will make a note. It is a mandatory, all the group should take the case, and they have to make a note of a case paper, and then they have to come and discuss their points, what are the things they have taken. And what we do in the next class, we tell them to present in a group form. The other picture, it shows the same case they have to present in a group manner. So when the group will come, so again we will divide the group into the students who has taken an history and all. They will start presenting what are the chief complaints, associated complaints and all respective. Some people, some students will do the examination on bedside. They demonstrate and they show us that what are the tests they have conducted on the patient and all. and what are the panchakarmas or what are the shamana aushadhis we have written to the patient, and they will, even some of the students will get the like the composition of the medicines whichever we have written, one drug or one medicine, they will tell the composition and how it is useful for that person. So one student will demonstrate that, the other students will be the listener for the bedside teaching. So this is also more effective for the students. Problem based learning, there are some of the topics in our syllabus like in Koshta and Agni Parikshas. Here this bedside we have did the Koshta and Agni Pariksha, the case of a Amavata to a girl. So here there is a difficulty for the student to assess like in how to assess the Koshta, how to assess the Agni and all. So by the demo we have shown the students like they have to make some questionnaires, like we will make them initiate them to ask the questions, this question will analyze to tell this one. So previously the theory part has over, and then the student has exposed to this bedside, that is problem based learning. They assessed the they ask the questions to the patient, they assess the posters, and they assess the Agni and all. What are the assessment bhavas they have to see in the classics and all. We have told in the theory class itself. So those things they have make a chart and they have asked. So in front of us, they were asking the student patient about the complaints, and then if any like in changes in their like in history taking, immediately we will interrupt and we will tell this is the way you have to ask and all. So this is a problem based learning we have to give to the students. This is a field visit. Actually, we will do the students field visit by the integration with the Dravya Guna department and all. But sometimes what happens, some of the like in second year they will finish their Dravya Guna tour, Dravya Gunas, all the like an aspects they have visited. But still, we wanted to make them like once again the clinically how to assess the things. If we go to the respective like in herbal garden in the respective like in colleges, with that the Svedahara, here I was explaining the Svedahara Dravyas, Svedakara Dravyas. So like an Eranda, Arka and all. So this type of a knowledge will help them to get what are the properties of those drugs and how we are using for the different procedures in the Panchakarma. So we took a field visit personally, and we even go plan to go for the Madana Phala collections and all, how the process should be done and all. So these things will be help the student to retain the knowledge for the longer time. This is the very important one, that is a role play. As we all know, all the diseases will not like present in the hospital bedside to make them to learn or ask the questions. So what we can do is we can create that role play. We have to tell here in this picture you can see one of the students, she has become a patient, and she knows the lakshanas of all the amla pittas and all, otherwise some of the very rare cases, and she will explain the things, and they make this role play. And some students as in like in interns and like it's doctor, they will ask the student, the her fellow student, that what are the complaints and all. So this is a role play, they will come, and some of the they completely do in a role completely completed with the role like an investigations and all, they will write and they will give. So it helps the students to more actively involve in this process, and with this we achieve as a disease as a treatment both together, they learn very effectively, and their critical analysis, critical thinkings will enhance more like, and I feel more than the like in bedside teaching, because once if the students feel themselves, then definitely they will remember or retain the knowledge for the longer time. So role play is very very important for the students for any topic, for the respective subjects. If you want it, you are getting a like an lacuna to make the such arrangements, so you can make in the form of role play. This is a DOPS. So the all the students, they have like an procedure skills. They perform the procedures, they prepare the medicines themselves, and they do the karmas. So then only they will come to understand like that how the temperature should be, what the things, how the things should be prepared, what are the precautions like in purva karmas we have to prepare, what are the things in the preparation, like in preparations we have to do, how it should be the performed in the pradhana karmas, what are the hurdles we get when we are doing a purva karmas, because in a theory class if we tell these are the purva pradhana karma pashat karmas, they think it is a very easy, because many students says it when they come to the hospital side, they says ma'am these are the more difficult tasks, because uh, 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 if we gather some things which is not available, again we have to go very far and all, then we have to collect it. So if we made the students to do all these things, then they will come to know that what scenario presently we are facing in the clinical side, so how they have to develop their skills and all, how the things should be gathered, because teaching the procedures, teaching the things is not important, rather that how the difficulty to do the procedures and all, that is also very important to show the students. And this isn't a part of a kinesthetic learning what we tell our students to perform, this is a janudhara. So here what we were doing, kinesthetic learning isn't like in tactile sensations, the students themselves they should feel the it, that is called as a kinesthetic learning. So if we tell that the temperature of the like oil should be like 25 degree or 10 degree like this, they will not come to know. So if we tell them you just do it, feel the temperature, feel the pulsations, feel the touch of the patient, then they will come to know that okay, this is the temperature I have to maintain for the student patient. And if the seasonal wise temperature will be changes, if the patient comes in the near to the summer, then they can't tolerate a more temperature. These things should be realized to the students. Otherwise what they do, when we were like it will happen practically when we will expose our students in the winter season to a patients, no, they will take a more temperature. When the same thing happens in the like a near to summer, they use the same temperature, but it is a atyoga for the things. So if we make them to kinesthetic learning, they will come to know that which type of the temperatures we have to do in the seasonal wise, like rutu anusara, how the things will be changed. Because by observing the things can't be deeper, but with the kinesthetic learning it will give the much more deeper knowledge to the students. And this is in quiz competitions. See, many of the topics we can't do bedside, we can't perform the like scenario based, we can't perform the like an indirect learning and all. So such topics if you kept for the quiz, you it is better. We have conducted a quiz, and quiz also not like in the other form, we have created a quiz and all, like we will show some pictures and all. So we ask them the context of the this one. So you can see in the slides there is a sun raising sun and heat, so where they can like can correlate this one. So when we ask this is sneha panakala, so when we have shown some basitit, kashayas, vatahara dravyas, then they call it as an iruha basti. So it is like very interesting teaching learning method which we follow in our college. So and we award them with the best team which has like a group has got a good results. And we kept the shloka rounds and all related to panchakarmas, and we tell pick and speech rounds to them. They will take a pick and they can speech on that topic. So when we tell the particular topics are there for the quiz, they will come with the preparation. And the good team, the random team, randomly we select the students. It's not like in 1 2 3 10 roll numbers, randomly we pick the students and we make a group. So which group will be performed, so it is a group connection, it is a collaboration to the students, they collaborate together and they come with the good outstandings. So this is in part of an integration. So like physiotherapy, in Panchakarma we have a physiotherapy integration, and some other subject also you can do the integrative classes for the other subjects are also. So here what happens, the integration will give the more deeper knowledge to the student for that particular subject and topic. If we teach superficially, the integrative classes they get more deeper this one the knowledge, but it is very difficult for the assess the integrative classes topics. So what we can do before itself, we can these things we can like an assess with the like in viva and all, if you have taken otherwise some projects and all if you given, no, definitely the students will come to know about the deeper things related to the topic. So coming to the implementation of the LH and NLH, if you see the theory and practical, it is a 1:2 ratios. The lecture hours is 100 and non-lecture hours are 200. In that also NLHT is 60 hours, NLHP is 160, 140 hours. So there is a one paper, especially for Panchakarma with reference I am speaking here. There are the so many like in subjects and all. It is just an example which I have quoted here to understand easily how the things in the syllabus it has divided. Like one theory is 100 marks, practical is 200 marks. In that also 100 is for the complete practical, the 70 is for the Viva, 30 is for the internal assessment. The total that is a 300 marks, that is 300 hours. Also we have. So how we have the distribution also given in the respective syllabus books, like the 200 practical, how we have distributed. This is the subject code and the distribution of the marks and how we have to see. So this implementation of the subject with hours, I have made a one table to make you understand. That is how we can make 300 hours fulfill in a year. That is specially a phase. That is a 15 months near. So if you take a Monday, Tuesday, Wednesday, Thursday, and Friday, you can make a B, C, D, E batches. And this table I have made with reference to the 100 intake. So if the college who have a 100 intake, make a 20 groups of the students, because why A, B, C, D, E, these batches are important. If the colleges, those who are going for the QCI and all, they want a rotation practical things. So it is very mandatory for all the, like, and even for NCSM and all. So to ensure the quality. So because we can't teach 100 students in a 2 hours NLH P class. So they need the quality assurance, how you are giving it quality to each and every students. So there the rotatory practicals is needed. So if you divide in a batch wise, like in 100 intake, 21 batch, so the 100 students will accompany in the 5 batches. And each Monday, Tuesday, 1 hour classes like this. That is a 5-hour class for the one subject in a week. So that class we can distribute LH hours. LH or NLHT is the second option. Third, fourth, Wednesday, Thursday, Friday will be the NLHP like this. With respect to the some other subjects and all, you have to make. But here I am telling the division of the hours how we can make in a week for one subject. So this will be 1:2 ratio will be justifiable. And in a 100 intake, of course, we have a 4 lecturers in the like in professor, reader, and lecturers and all together 4 people. So we can like lecture 1, lecture 2, lecture 3, lecture 4, lecture 4. We can take these hours for the teaching with some other additional work and all. It will be in the respective colleges, and the totally 5 classes in a week. That is 5 hours in a week for a subject. If it is 100 marks, 5 hours means that is in a month 20 hours. So we can fulfill the 20 hours in a month. So if 20 hours with 15 months, 300 hours will be completed for a one subject. So if anyone having a extra hours, the hours should be calculated per day and per week. So how monthly you are getting. So because this is very important if you calculate like this, because the term should be finished within that. So another timetable which the NCISM have given an option to us is 1 day 1 subject timetable. So this is also very important. I feel 1 day 1 subject is also the more feasible for the subjects to justify. Like if we have a 6 hours of the college, then 9 to 10 a.m. 1 hour LH, 10 to 11 1 hour like an LH or NLHT, 11 to 1 that is a 2 hour NLHP, 1 to 2 that is if we send the students for a lunch hour, then okay, 2 to 4 p.m. NLHP, that is a 2 hours. So total we are in a day 6 hours we are getting. So like this, 1:2 ratio will be like in justifiable, and 4 lectures will be conducted in this manner, like 9 to 10 one lecture, 10 to 11 another second lecturer, 11 to 1 another lecture, and 2 to 4 the fourth lecture. They conduct the classes like the 4 classes in a day. So like this, in a week 6 hours, in a month that is a 24 hours. So 24 hours in a month to 15 months, it is 360 hours. If we minus the 300 hours also, we are getting a 60 hours extra for 1 day 1 subject. So we can justifiable more easily in 1 day 1 subject timetable. So these 60 hours also sometimes is the festival, some summer vacations, some festival vacations and all, students internal exams and all. can be like utilized. So we can justify if we do 1 day 1 subject. So it is depending to the colleges how they are selecting for the timetables with respect to the other subjects, and the college academic committee will decide. But the your expectations of the hours should be like this. So what are term wise NLHT and NLHP and lecture hours? To before the first term, that is we get 31 hours, 18 hours and 42 hours. And second term 39 hours, 24 hours and 56 hours for the NLHP respectively. And the third term 30. So like this 100, 60 and 140. This is the division of the lectures in the teaching manner. So many people, whenever I went for the curriculum orientation program, no, they were asking the same question, ma'am, is it possible for to finish first term in 31 hours itself and all? See, it is a try for a zero error work. We can't assure 31 hours will be first term sufficient. Sometimes it may be 40 hours also we take. It is according to, there is an plus or minus hours will be definitely happens because of the vacations, because of some of the pandemics and all such kind of the things, some disasters in the respective places and all, the things will be disturbed. So what we can do is plus or minus hours can be feasible. You can, but you have to make sure that the term should contain the syllabus which we are like added in the syllabus book. So in the first term, that syllabus should be completed. So it's not mandatory that all the terms should be in the singly teaching. So if you have a Costa assessment and a Costa this one, no, you can make a NLHT, NLHP together to consume the hours, and then you can take the NLHT first in a first hour, and second hour you can start NLHP of that hour. So it will be helpful for you to make the syllabus to complete, and it is the first year, so definitely it will difficult. So coming to the end, what's the outcome of the TL methods, that is teaching learning methods? Why we are like 1 hour and from so many, like, and after framing the syllabus and all, many people were asking why it is needed. Yes, it is needed. It is needed to make the students critically thinking. It is needed to make the students more creative. It is needed because the students should be the more collaborative, communication should be increased, their information should be in a deeper media, and they should get some media literacy, and all these things like all the career and learning, self-reliances, cross-cultural understanding and all, literacy, computing and ICT literacy. So these all things we needed for that method. For this purpose, TL methods are needed. With this, I will conclude. If any questions?
Thank you so much, ma'am, for the wonderful presentation. I request if anyone is having any query or question, you may raise your hand so I can open. Tejaswita, you can unmute yourself and raise your query. Tejaswita.
Very good afternoon, ma'am.
Yes.
Ma'am, my query is the DOPS which you had taken.
Yeah.
So for the QCI purpose, we also required to document these different assessment methods.
Yes.
So can you just give me a brief key, how should we document DOPS, DOAP, OSCE, OSP, these methods?
Yes, ma'am. Actually, no, we have some checklist for to document because that is as assessment. It's a part of assessment. No, that's why I have not mentioned here in the TL methods, because to monitor we need some checklist to prepare for the DOPS, OSCE, and OSPI, and we have that
Right.
checklist also. That how the students has performed this one. There is a ratings you have to like in grading, grade 1, 2, 3, 4, 5. If the performed very well, then give the grading 1 will be the best if you chosen. If no, the students has not performed properly, you put the 5 like this. So
Okay.
that is a
Okay.
grading method checklist you have to prepare, ma'am. Respectively checklist if you prepared, then definitely it will be like an documentary for you for a QCI what we are doing in our college.
Okay, okay, ma'am. Okay, thank you, ma'am.
Okay.
Thank you so much, ma'am. Dr. Himani Sharma, you may
Yes.
raise your query. Dr. Himani, you can unmute yourself and raise your query. Dr. Himani. Oppo CPH, can you rename your profile? You may raise your query. Yeah, Dr. Himani.
It was same question.
Yes, ma'am.
Ma'am, it was the same question before.
Your voice is not much audible, ma'am.
Your voice is not clear, ma'am. Dr. Ujjwala. Dr. Ujjwala.
Hello. Good morning, madam.
Good morning.
Hello.
Good afternoon, ma'am. Good afternoon,
मैडम
ma'am.
हाँ गुड आफ्टरनून यानी जैसे कि ऑस्पी है तो ऑस्पी स्टेशन अगर 100 स्टूडेंट है तो
हाँ
ऑस्पी स्टेशन कितने चाहिए मैडम?
किस मैम असेसमेंट टुमारो आपको प्रदीप शिंदे सर पूरे असेसमेंट चीजें
ओके
बता
ओके
देंगे मैम कल के
ओके ओके
लिए वो है सर के लिए
ओके
सो
ओके
असेसमेंट
ओके
सर का है
हाँ एंड second question is there is a point horizontal and vertical in
या
syllabus तो
वीएस
हाँ 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 यस यस तो उसके लिए जो डॉक्यूमेंट्स है जैसे कि UCI को हम डॉक्यूमेंट सबमिट करते हैं
यस
हॉरिजॉन्टल टीचिंग लर्निंग मेथड या वर्टिकल टीचिंग लर्निंग मेथड
यस
तो वो जो डॉक्यूमेंट्स है उसके लिए सिर्फ फोटोग्राफ्स काफी है?
No, ma'am. Actually, if you are doing a vertical like in section with the Rasa Shastra or some other
Yes,
department,
yes, 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 yes.
yeah,
Dravya Good,
Dravyaguna and all for
Yes, yes,
us,
yes.
yeah. If we are like sending to the Dravyaguna department, what you have to do? It is a departmental letters you have to like exchange, like
Yes,
that
yes, yes, yes. That
head of the
that we
department, yeah, head of the
that we
department.
are taking. Yes, 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 yes,
Yes,
yes.
ma'am. On
Only
that,
only letter is sufficient, madam, na?
yes, ma'am. For that,
Okay, okay.
and your like in geotag photos, that's
Yes,
sufficient
yes, yes,
for
yes.
us, ma'am.
Geotag photo that is also I am taking.
Yeah, and the
And
attendance on that,
letter.
ma'am.
Okay, 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 okay. Thank you, madam.
Okay, ma'am.
Thank you so much, ma'am. Dr. Rajkumar Gupta. Dr. Rajkumar Gupta, you may raise your query. Dr. Rajkumar.
Yes, sir.
Yes, sir, please.
Ma'am, my question is when
हाँ,
we
ma'am.
frame the time. Hello, am I audible?
Yes, sir. Yes, sir. बोलिए sir.
Yeah, my question is when we frame the timetable,
Hmm.
there are at least 4 to 5 lectures per subject. And in one department, there are three, on an average, 2 or 3 faculties for a subject. Okay.
Okay, sir. Okay.
And this question is always raised from the students that during a week, the student is exposed to all the subjects and all the faculties.
Yes.
So what happens? Suppose my subject is Dravya Gun, and if I teach, I start Rasa from Monday. What happened? Ki usually we allot different topics in ATP to different faculties. Suppose my junior lecturer is taking Guna, I am taking Rasa, and my another faculty is taking Virya. So Rasa takes at least 6 to 10 hours, at least in curriculum, some 10 to 11 hours are given to Rasa. So what happened? On Monday, I go to the class, I teach Rasa. On
Okay.
Tuesday, my next faculty go and she starts with Guna, and next day start with. So what happened? So students are exposed to 6 subjects with 18 faculties with 18 different topics. So they get confused and their brain cannot accommodate with this different 6 subject, and in one subject 3 different topics in a week. So how to solve this problem?
Sir, actually, no, practically what in our college, with the subject wise, I am speaking in Panchakarma. So we have started a modular teaching, sir. So modular teaching will help to resolve this kind of a things. For example, I will tell you, it is as in Panchakarma, I am. So if we have the first class will be like in definition of the Vamana or definition or the classification of Vamana, and these things by dealt by the first lecture in the Monday. The second lecture is minds. If it is minds, then I will continue that session. Like after the like in the definition classification, I will go with the Vamana Dravya Guna Karmas and Vamana Upaga Dravyas. So it is a continuation of the topic. And the third lecture of my department, when they will expose to the practicals NLHT and NLHP for the collaboration with these two previous topics. So we have to make a modular timetables of the respective departments, sir. It is a one-time task. Once if you prepare the modular like a timetable, it is used every year with the different dates and all. So you have to prepare to resolve these things, because when we were students, no sir, that time no, we used to teach like this. Like Vamana will be dealt by some lecture, Virachana will be dealt by some lectures, and Nasa will be dealt by the some lectures. So Monday one lecture used to come, Vamana definition. Tuesday it was the previous like teaching, sir. But when you the new syllabus of NCM, when it has came, no, if you go through the syllabus, it is like in modular form. You have to prepare the timetable, which is expected by even a QCI also. So once if you prepare the modular type of a timetable, definitely your problem will be solved, and that topic will be dealt by all the faculties, sir, and we will be touch with the that depth of that topic, because I am not an expert of Vamana, I am an expert of Panchakarma. So I have to take a class of all the topics. It does not mean Vamana is teaching best by that doctor, that's why we have to every year give Vamana. No sir, we are experts of the MD. So then we have to teach all the subject equally whenever it comes, because it is difficult for the initially assistant teachers, lecturers who are like in the like in for the teaching when they enter. But it is not difficult for after the 2-3 years of the practice of the teaching. No, it will be like inbuilt in them. So it is very easy if you make it as a modular teaching lesson plan, sir. If you want, definitely I will. If anyone is a Panchakarma people here, I definitely forward our teaching lesson plan to you people. I don't have any issue. So it will be helpful for everyone.
Thank you.
Okay, sir.
Thank you so much, sir. Dr. Sahana. Dr. Sahana S. Yes.
Hello. Good afternoon, sir. Good afternoon, ma'am.
Good afternoon. Yes, Sana.
Yeah. Ma'am, with regard to the practical hours, is there any rules that the practical hours should be compulsorily scheduled for 2 hours duration, ma'am?
No. If you want, you can make 1 hour also. You have seen my timetable, no? See what happens, no? Why it will feels difficult, because we will never prepare anything. We have to keep everything ready before the practical like started. What we do, if 2 hours will also less, if you start the collecting the gather the materials and all when the students come to the class. So, and always I feel the practical should be at the end of the college hours. Like if the morning 9 to 1 o'clock the theory sessions, 2 to 4 should be the practical, so that the students, that is a sleeping hour, what we call afternoon. So you can easily manage our afternoon hours. 1 hour will also be sufficient for your like NLHT and NLHP.
Okay. Okay,
And
ma'am.
we are
Thank you.
doing that. We are doing it practically here.
Okay, ma'am, and then most of the colleges here in Karnataka, we are like on a daily basis, we work for 6 hours, and also Saturdays are working for us. So, suppose like if at all our first term portions are completed, and without compromising the the content, etc. So, before the can we even start with the second term syllabus? Is that permissible?
Yes, ma'am. There is no any hard and fast rule that you should not start the second one. You can start it, but that is make sure the student should not get a overburden of it. That is the important, because if you started the second term, no, then the student should not feel like that there is a huge syllabus for the terms.
Okay, because ma'am, if you see subject wise, like in our subjects, Vastavritta, in the very first term, there is like just 75 LH and NLHT hours, whereas in the second term, there is 128 hours, ma'am. And also the students are supposed to go for vacation in the second term itself. So the burden is actually more in the second term. So to ease that, So it's fine, right? If we start the classes in the first term itself.
Yeah, it is a feasible. You can change. You can change. The main intention of the syllabus framing is students should not get more burden. No, so you can take it in the first term also. Some of the topics you can take in the first term, but it is you should not give it to the like in an exams and all. You can put in a multiple choice and all also you can, but long questions and short questions don't prefer in the first term if you completed syllabus also, because students will not be perfect with the first term syllabus.
Yeah. Thank you, ma'am. Thank you.
Okay.
Thank you so much, ma'am. Further question shall we take later?
Okay,
We,
sir.
we will take other questions later after the second session. Now I request
Shall we
Dr.
move to
Tripti.
the session?
Yes.
Yeah. So my heartfelt thanks to Dr. Shilpa Raga ma'am for sharing different teaching and learning based on the learners' different teaching technologies. Thank you so much, ma'am. So we will move on to our next session, that is fourth session, Educational Media and Teaching Aids by Dr. Prajna R. Kapse, Assistant Professor, Department of Shalya Tantra, Arya Podar Ayurveda Medical College, Mumbai. Ma'am is having academic experience of 17 years, PG and PhD guide. She's a Senate member, MUHS Nashik, Maharashtra. She's in a research panel for basic and advanced research methodology courses of MUHS Nashik. She's also HSET, MET faculty and NABH assessor. Now we will listen to our the second speaker of today's session today. That is Dr. Prajna R. Kapse, ma'am. Over to you, ma'am.
Am I audible, Tripti ma'am?
Yes, ma'am.
Yeah. I'll just share the slide. Is it visible?
Yes, ma'am. Make it
Okay.
short.
A very good afternoon to all of you, and it is my pleasure that I'm here to share my views on this topic with you all today. I'm very much grateful and thankful with Team NCISM, especially respected Chairman Madam, Dr. Manisha Kothekar Madam, President Board of Ayurveda, respected Dr. Alam Prabhu Gupta sir, and the whole team of NCISM and core team members of Faculty Development Program, and all respected dignitaries present over here on this platform. So, without wasting much of time, I will just start with the topic educational media and teaching aids. I'll just share the slideshow on. Why educational media and teaching aid is the most important topic that we thought to take in this syllabus, being in faculty development program committee, because educational media, as all of us we know, that it refers to the various tools and channels used to communicate our knowledge, such as audio, video, digital platforms, and visual materials also. So there are number of teaching aids which are supportive materials used by teachers nowadays to enhance understanding, including various objects like projectors, charts, models, multimedia presentation, etc. So basic need, what I feel is, for education media and teaching aids, it arises because students have different learning styles nowadays. Some learn better by seeing, some learn better by hearing, and some through practical experiences. So these tools, they help bridge that gap and make learning more inclusive. So with this today's topic, the main objectives of this lecture that the faculty will be able to define and differentiate educational media and teaching aids. Various affective, psychomotor, and cognitive domains are applicable to these objectives. Explain the importance of AV aids using the cone of experience and its effect on retention. That is, the understanding pattern will be applicable here. Then the faculty will be able to classify and apply teaching aids, that is audio, visual, or AV, with one subject specific example. Here the domain applied will be understand and apply. Then the faculty will be able to analyze strengths and limitations of traditional versus digital aids for diverse learners. Then the teacher will be able to select and justify appropriate media based on learner level, content, and resources available to them. He will be able to demonstrate integration of a 5-minute AV aid into a 40-minute lesson actively, where the application-based domain will be effective. And he will be able to design a micro-teaching activity combining lecture plus AV aid plus hands-on training or hands-on aid, etc. So here the creativity domain will be more applicable. So likewise, various domains which are explained there in the Miller's pyramid, they are applicable here, like cognitive, affective, and psychomotor. And the whole combination of all these teaching aids in mix all together will impart to a good education. So हम लोग ऐसे बोलते हैं कि चरक ने सूत्र स्थान में बोला है, दृष्टम श्रुतम अनुभूतम च यत् तत् सर्वं प्रमाणतः मनसा चिंतितम यच्च तदपि ज्ञान हेतवः. तो जैसे भी आप देख सकेंगे, सुन सकेंगे और प्रैक्टिकल एक्सपीरियंस कर सकेंगे, ये सारे एंगल से whatever the knowledge you are gaining from all the parts of the teaching aids, that is the most appropriate and good knowledge that you will learn, and you can also give to your students as well. So what is educational media basically? So educational media refers to all the tools, materials, and channels used to support teaching and learning by making information easier to understand, more engaging, and more effective. So in simpler terms, we can say that it is any medium used to communicate educational content with the different types of learners. So there are number of types of educational media where we can just have a look here. Print media, audio media, visual media, audio-visual media, and digital or interactive media. In print media, we can see here the textbooks, journals, number of various journals are there, national, international, UGC, Scopus, PubMed. So all types of educational journals are getting included in this print media. Newspapers, various types of e-newspapers, we can just adapt to learn many things. Charts and posters are there included in this print media. In audio media, we can say radio programs, podcast, and various types of recorded lectures or e-lectures or e-books, we can say. The students can use these to take or to gain the knowledge. Visual media, it includes the various types of diagrams, graphs, maps, models, from which they can just get the practical knowledge, and the memory part of their brain will be fixed with the visual aids, and the core idea will get very clear to the students because of the visual aids. Audio-visual media, it includes videos, television programs, multimedia presentations. Then digital or interactive media, it also includes e-learning platforms, mobile apps, different types of variety of mobile apps are there nowadays in market, we can see. Even the smaller children are getting very much used to it. Virtual classrooms are there, which we are using in our learning institutes also. and simulations based various practical knowledge और simulation lab, skill lab, योग्या जिसे हम कहते हैं, so that can also be dealt with this concept of interactive media. So looking forward towards the key features of educational media, this type of aids, it enhance the understanding and retention of the knowledge. It makes the learning interesting and interactive. It saves the time and efforts in teaching. Various types of educational media aids, they cater to different learning styles, and also it provides us quick clarity of concept. So this is very important that all types of teaching aids can be classified into different variety of subjects or types, and these teaching aids play a vital role in shaping effective learning experiences in the medical education, we can say. So they not only support the teachers in delivering knowledge, but also empower students to learn in a more meaningful and enjoyable way so that they will not get bored. So various types of these aids, we will be dealing with them later on. Now, what is the need of these aids? Number of aids we are just looking, and why it is required. So traditional lecture was much better. Many teachers, they feel कि हम लोग जैसे पहले सिखाते थे ट्रेडिशनल वे से, that was more interactive. उससे स्टूडेंट से बहुत अच्छा कनेक्ट होता था. Now, what is the need of all these different types of aids? इतना सब हम हमारे माथे पे मार रहे. But this is not the way. So the basic need in today's world, teaching patterns have changed from classrooms to students. So changing with the time has become the necessity of the society. So we have to adapt all these changes. So starting from ourselves, we can impart this to our students and the whole community in the medical education. So we can enhance understanding, it improves the retention, it makes the learning interesting and all the ideas clear to the students. It will support us different learning styles with different learning styles. It encourages active participation. It bridges the theory and practice all together hand in hand with integrated approach. It keeps pace with technology. It saves the time and effort, and also the short attention spans are there, with which in short time we can elaborate any concept better more than we were explaining in the traditional ones. So it will avoid long and monologuous lectures. So active learning and active interaction will be there and not a passive one. So coming to the different types of educational aids, there are number of educational aids, as I told you, that visual aids, audio visual aids, digital aids, etc. So coming to first visual teaching aids, it simply says that it is a learning by seeing. Now, whenever we see that visual teaching aid, these are the tools that help students learn through watching or seeing, what we can say. They present information in a visual form, which we can clearly see with our eyes. They are making it easier to understand, remember, and relate with the concepts clearly. So whenever we read any concept in the textbooks, and whenever we see that actually, for example, I am performing hernia surgery, I am a Shalya Chikitsak. So before that, being a student, I will have to read the anatomy of the inguinal canal. Then whenever I will actually see this inguinal canal on the patient in the operation theater, this concept will be more clear to me. So the present information in the visual form, if I will show the videos of the same to the students, again it will make it easier to understand. It will make it easier to remember. It will make it easier to relate to the concerned concepts. So these aids are especially useful, what we can say, for explaining complex ideas in a simple and engaging way. So this is very, very effective teaching aid. Here we can quote few examples like blackboard or whiteboard, charts and posters. Flashcards are there. So various flashcards we can use to elaborate a few concepts to the students. And we can also use maps and globes also. We can have the use of graphs and various diagrams to elaborate. Also, the models can be used in the same visual aid. So, number of posters and pictures are there, slides and presentations, of course. So, all they are getting included in this visual teaching aid. Then, importance of visual teaching aid, as I told you. So, students tend to remember what they see for a longer time. So if we see the scientific research papers, if you will search them on the Google or internet, you will find that students tend to remember what they see for a longer time, which improves the retention more better. So they can also save the time for teachers by explaining concepts quickly and effectively. So very, very simple, and it can simplify the difficult topics. It can grab the students' attention very easily. It will improve the memory and recall factor of students, and it will surely encourage active participation in your teaching also in the classroom. So to make lessons more engaging, you can use these visual teaching aids which play a vital role in modern education. By combining words with images, they enhance the learning and make the classroom experience more effective and enjoyable, as I said earlier. Now coming to the next audio teaching aids, that is learning by hearing. So as we see here, audio teaching aid means these are the instructional tools, we can say. So we use sound to support teaching, to support learning. So these audio teaching aids, they help students learn by listening, making lessons more engaging and easier to understand. So especially for auditory learners, all these audio teaching aids are very, very, very useful. Now these are number of examples which are quoted here. So mostly in a common, we can just use these examples as audio teaching aid, like radio programs, tape recorder, podcasts, language labs, e-books, and recorded lectures. Many a times we can also have a use of songs, different types of rhymes, especially in early education. Then, as I told you, spoken word explanation and storytelling. So all these are digital audio platforms can be incorporated and used over here. And this is how we can make it more effective for developing better listening skills and improve the concentration of the students. So they are very useful in language learning. They are very useful in, we can say, pronunciation practice. They can very useful in understanding tone and expression. So they can be effective in all these ways. They also make learning very flexible, as students can listen and revise lessons anytime. So these are various advantages what I told you for these audio teaching aids, and mostly they help in self-paced learning. So self-paced learning where the student can learn on his own with his own pace and with according to his own convenience. So that is called self-paced learning. It can reduce dependence on the textbooks. So if he at all he is not having any textbook in his hands, he will not have to carry so much luggage on his back while going to the college. So likewise, the advantage that he can gain by reducing the dependence on the textbook by using these audio teaching aids. Also, we are having a few limitations as well, no doubt. So these audio teaching aids, they cannot show visual information. Even they may not be effective for all subjects, all topics. They help in self-paced learning, as I told you, but they require proper equipment and instrument at that particular time. So if you don't have the good equipment and instrument for using this type of learning method or teaching method, then that will not give a good effect that you want, exactly being a teacher. And also the lack of interaction compared to live teaching. So many teachers, they feel that this also may be the limitation of this method. So these audio aids are an important part of the medical education, we can say, which support teaching by strengthening listening skills and making learning more engaging, especially when combined with other teaching aids also. Now coming to the third part, that is audio visual teaching aids. Here, two types of actions are being incorporated or included. One is watching with eyes and another one is hearing with ears. So these aids are modern instructional tools. They combine with both sound and visuals, we can say, to make learning more interesting and interactive also. So they help students learn by seeing and hearing at the same time, which improves understanding and retention of the information. So many examples are there we can quote here for these AV aids like television, videos and films, documentaries, PowerPoint presentations, then we can say projectors, computer-based presentation, it includes PPT, projected slides with narration, whatever we use in animation or simulation type of techniques, that can also be a part of this AV teaching aid. So number of or various types of online learning platforms with video lectures are also getting included in these types. So these AV aids, they make learning more realistic and elastic. They help students understand difficult concepts easily by showing real life examples or various types of demonstration. So if I show them actual surgery of hemorrhoidectomy or actual surgery of lipoma excision, so this is the visual activity, or any video that I am showing them during the classrooms, during the lectures, that will be helpful for them to understand difficult concepts easily by showing real life examples or animations. So they also cater to different learning styles and keep students more focused in the classrooms. So audio visual learning is very effective in the education media, and it is helpful to make lessons more interesting while teaching and learning also. And it also helps in long-term memory retention as well. Now coming to the activity-based experiential aids. This is very important teaching aid in the educational media, what we can say. Actually, activity-based and experiential teaching aids, when we see or quote or when we tell about this concept, these are the medical learning tools, or we can say integrated learning tools, which focus on learning by doing. So here, when we see, you must know, or all of you must be knowing the Miller's Pyramid. So Miller's Pyramid is a foundational framework for assessing clinical competence in the medical education. So it is developed by George Miller in 1990s, and it structures the learning into four hierarchical levels: knows how, shows how, and does. So representing all types of domains, that is cognitive domain, which is knowledge based, affective domain, which is attitude based, and psychomotor domain, which is skill based. So all these progressive domains, from foundational knowledge to autonomous clinical practice, it is getting involved in these types of activity based teaching aids. So basically, what we can say, that these methods, they make learning more practical, more meaningful, and long lasting also. So activity based teaching aids, they involve learning through structured activities, various types of experiments, as group work or role play, or we can say various types of games, quizzes, hands-on tasks. So all types of examples are there, which are quoted here, you can see. So educational games, field trips, demonstrations are the types of these activity-based experiential aids. And these examples, they include all these types, which help students to connect the classroom learning with real life situation. So they encourage the curiosity of the students. So that if I will say that if you will do like this, the final picture will be like this. So this will be my theory. But whenever they will actually perform it in the experiment model or experiment basis, on the experiment basis, the concepts will be more clarified and clear to them. So that will encourage the students' curiosity, that will encourage the students' creativity. Also, that will help to encourage the students' critical thinking also. So students, they become active participants in this teaching learning method. So activity-based experiential aids are very important to improve understanding and retention, and they promote the active learning, as I said. They develop the practical skills and problem solving ability of the students. They make the concept, whatever you are teaching in your subject, enjoyable and engaging, and also help for deeper understanding. Also, few 2-3 limitations that I feel while using this type of aids in our teaching, that it is no doubt a little bit time consuming to plan and to conduct also. We may need more space for the execution of this particular activity. We may require more resources and materials. We may need proper classroom management, and always not always suitable. It may not be suitable for large classes, or if you are having very limited time and you have to clear or teach many concepts at a time. So that will not be beneficial. So all these advantages and disadvantages, considering them, they shift learning from theory to practice. This is the no doubt understanding. Now, they help students gain real world experience. So if you feel that students should get this type of experience, if they should develop essential life skills, then you can definitely have the use of these activity based experiential aids while teaching. So now coming to the next topic or type of the teaching aids, that is ICT based digital teaching aids. Now ICT, it is meaning, having a meaning like information and communication technology. So ICT based digital teaching aid, it refers to the instructional tools that use the information and communication technology to support teaching and learning. Now, why it makes more interactive, more flexible? Because it is student centered by using digital devices, digital softwares, and online resources. So they involve the use of computers, they involve the use of internet, multimedia tools, and digital platforms to deliver different types of lessons. They help us explain concepts and assess the learning very easily. So, as I have mentioned here, the examples on this slide: computers, laptops, smart boards, educational apps, different types of educational websites and e-learning platforms, you can say, online classes or virtual labs and simulations, we can have their use here. Then video animations and educational YouTube content also, it is getting included in this ICT based learning. Avatar teacher, it is very famous nowadays and many techno-savvy students are taking benefit of it and just using these for their learning purpose. E-books and digital libraries also are included in this. So these aids, they make learning more effective, up to date with modern technology, and they help students to access vast information. So if one single concept I have told them to just search, for example, the surgical anatomy of the femoral canal. So whenever they just put the single word in the computer software, they will have lots and lots of information at a glance in a second. So this is very important, that this platform, it helps the students to support the distance learning, to support the self-paced education. They can have the information on their own according to their convenience in more clear and attractive way. So advantages of this ICT-based digital learning: it makes learning very interesting. It provides quick access to updated information. Then it supports the remote and flexible learning. It enhances the understanding through multimedia concept. And it also encourages independent learning and digital skills also. So those who are interested in gaining all these techno-savvy or digital skills, they can have the use of this information communication technology based teaching aids. One or two limitations also are there, as I told कि हर एक का फायदा और advantage and disadvantage होता ही है. So there are two sides of each coin. So these ICT based digital teaching aids, they may require internet, they require electronic devices, so they can be expensive to implement also. They may need technical skills and training, no doubt. So many senior teachers, they may not adapt these types of techniques. Then they may cause distractions if not used properly, or they may not equally accessible to all students because of their various positions and conditions. So these are few of the limitations also we can see. And in short, these ICT based digital teaching aids, if we use them properly, with proper use, with proper time and with proper planning, these are essential part of the medical education. What I feel, they improve the quality of teaching and learning by making education more accessible and technology driven. So this is how all these topics of types of the teaching aids, they can be explained and understood. Now coming to the more interesting and very, very touching and interesting part of most of the teachers had, that is traditional teaching aids. सो अब तक हम जो सिखा रहे थे बच्चों को, तो वो सारा ट्रेडिशनल टीचिंग एड्स ही था. डायडेक्टिक लेक्चर्स वेर देयर, and these are the conventional tools and materials used by all the teachers in classrooms to explain concepts and support learning without the use of advanced technology. So no advanced technology is included in this. These aids, they mainly rely on the physical objects. They mainly rely on the textual references, textbooks. They mainly rely on the face-to-face teaching methods. So traditional teaching is simple instructional material, what we can say, or tool used to make teaching more clear and understandable through direct demonstration and explanation. That teacher is there in front of the student, student is there in front of the teacher. Now, these are the few of the examples: textbooks, chalk and board, lecture method, printed materials, or many one or two we can add in that, flashcards, models or real objects, or the drawings or diagrams. So likewise, they can have all these examples to be included. Now, importance what we can quote here of these traditional teaching aids is they help in making abstract concepts more concrete and understandable. So if any concept is explained in the textbook or any chapter in a short words or a small paragraph, the teacher is one who can elaborate that concept or even a single concept or even a single word for an hour. So एक कंसेप्ट है तो वो उसके ऊपर हम लोग 1 घंटा भी बोल सकते हैं, इतना ये ट्रेडिशनल टीचिंग एड यूजफुल है. So the more elaborative and explanatory conceptual training that can be given in this traditional teaching aids, and even they are widely used because they are very simple to adapt, they are very cost effective, and they do not require any electricity or any advanced equipment. So they also encourage direct interaction between teachers and students. So many teachers, they will be happy to hear this. हाँ, ये बहुत अच्छा है, हमारा बहुत पहले से चलता आ रहा हुआ एड है. So why not to use this? So we will come to that point also in next slides. Advantages that we have seen in these traditional teaching aids, that they are cost effective, they are affordable, they do not depend on any internet, they encourage the teacher student interaction, they are useful in all types of classrooms, including rural areas. So I agree that these are the advantages. Few limitations are also there with this traditional teaching aid method, that it is less interactive compared to modern aids. Because when we just give lecture in 1 hour in the classroom, it is not an active interaction. 90% it is passive. We keep on talking to the students, we keep on explaining the terms, we keep on going with the concepts, that because we have to complete the syllabus in the given hour, and we are just finishing without taking the understanding or without taking it in the into our consideration that the concept is being understood by the students or not. So the less interactive compared to the modern aids. Now it is having limited visual and audio impact. It may not fully engage the students. Many backbencher students, they are sleeping, they are yawning, and we are just rushing with the time and with the concepts, keep on talking and talking in these didactic lectures. So no interaction, no two-way talk or no two-way teaching learning. So it cannot show dynamic or complex concept easily. It can become repetitive and less interesting. So traditional teaching aids, they form the foundation of the classroom teaching, no doubt. It is very important, it is useful. Even in medical education, they remain important because they are simple, reliable, effective, more explanatory, basic concepts clear, explaining basic concepts clearly. Now, when we see all these types of teaching aids, we have to incorporate a combination or an integrated approach of all these in our teaching. जैसे हम बोलते हैं कि शिक्षा केवल किताबों तक सीमित नहीं होती, सीखने का हर साधन ज्ञान की नई रीत होती है. तो उसमें हम ये भी कह सकते हैं कि चित्र, ध्वनि और अनुभव का संगम जब होता है, तभी शिक्षा का हर पाठ सरल और सजीव होता है. So this is very important that we have to inculcate, we have to use all these combinations on a mixed platform, and we have to make our teaching more explanatory, effective, considering students as our center point. Now, how to select appropriate AVAs? So, based on the objective, we can select or we can choose the aids according to the learning goal. Whatever subject or topic I will have to teach to the students, what are the objectives behind that topic? Accordingly, I will have to select that AVA. For example, if I want students to learn for the surgery of hernia, then it is my responsibility to show them actual video for the respective surgery. So here the AVA, whatever I will have to use, that will be what I can say, the video, proper video of the surgery, which I have to show them during the classroom lecture. Video for the procedure or any type of chart for the summary, if I can use in the classrooms, that will be more effective. Based on the content also, we can select the appropriate AVAs. Like for complex topics, use videos or different types of animations. For a simpler topic, you can use simple blackboard, whiteboard, smartboard or charts. So accordingly, it depends on your objective, it depends on your concept, it depends on the audience also. So what type of audience you have? If you are teaching to the undergraduate students, so you have to use more simpler and clear visuals in your teaching aids. If your audience is advanced learners, then you will have to shift to the detailed diagrams, case-based videos, etc. Then based on the availability also, you can use you can select the AVAs. You can use aids that are easily available and functional. You can avoid technical tools if setup is unreliable. So based on the availability, it is very important to select our aid while teaching. Also based on the time, if you are taking a very short lecture or you have only a time of, you can say 15 minutes. So in that 15 minutes, you want to clear or cover a concept which is much bigger. You can use PowerPoint presentation. You can use chart. So if you will make the chart, if you will make the poster and if you will show it to the students, the concept will be clear to the students at a glance with a short duration of time span. If you are having ample of time with long session, you can have the mixture of different types of aids like videos, like discussions and all that. Then coming to the clarity and simplicity. So We have to avoid overcrowded slides. We have to use readable fonts and clear diagrams. Now, coming to the most important point, that will be the teacher competence, and that's why the NCISM has just encouraged to all the teaching faculties to implement this curriculum, which is competency based curriculums, because firstly all the teachers will have to adapt this competency, then only we can force students to adapt all these and to learn these techniques. So the teacher should be comfortable using the aids first, the teacher should be competent enough, and the teacher should have enough practice and confidence beforehand, especially for digital tools. So practice and the willpower to adapt new knowledge is the most important thing that I feel. Then interaction. So we have to use these aids to engage the students, not just display the contents. So the teaching should be interactive in from both the sides. Not only like that being a teacher, I am explaining, I am not at all taking it into consideration whether students have understood that concepts or not. So I have to interact with the student. I have to select any student in the classroom randomly, make him stand, just confirm whether he has understood that concept or not, ask the questions. If he has not understood the concept, pause the video, pause the whatever aid you are using, and encourage the discussion till the concepts get cleared to all the students. So the interaction is very important here in this platform, on this platform. So proper integration. Audio visual aids, they should support teaching, they should not replace it. So teaching will be but obvious, it will not be replaced by any type of tool, but the audio visual aids, they have to be used for just a support in our teaching. So we can explain alongside the aid. So not just you are just what we can say, showing the PowerPoint presentation to the students. Students just read it. We cannot say like that. You have to explain each and every concept which is explained on the bullet points, and then only students will get that concept clear. So go on explaining alongside the aid. Various types of aids you can use, as I have explained earlier. Then coming to the evaluation. So just check whether the students have understood the concept or not. This is very much important for our competency-based dynamic curriculum. This is very much needed in the assessment platform that we are dealing with in the tomorrow's session. Then we have to take feedback or ask questions after using the aid and just confirm whether the student or the learner has got that concept clear or not. So evaluation based feedback we have to have in our teaching. Without that, our teaching will not become complete. Now coming to the next type of teaching aid is the PowerPoint presentation. Now there are certain principles in PowerPoint designs, as we can see here. The first and foremost important feature of this PowerPoint designing is simplicity. So we have to keep slides very clean, very uncluttered, very tidy, very neat. We have to avoid too much text or too many elements on one slide. Focus on one idea per slide. Number of ideas many a times are getting bombarded on one slide, but that slide gets crowded and the concepts will not get clear to the student. So just make it very simple to understand. clarity and readability is very, very important. So use large readable fonts, at least 24 to 32 size. Maintain proper contrast. This is very important. So if you are having dark text, use light background or vice versa. Avoid fancy or decorative fonts. So they are giving trouble to the eyes of the teachers as well and to the students as well. Now this is the explanatory slide. The larger, the better. Now, if you are using good title slide, then the font should be like this. For example, Vardhana 40 point. If you are using subtitle below that or bullet, then the point size will be Vardhana 32 point. And if you are just typing the content text, then the size should be more smaller than the subtitle. For example, Vardhana 24 point. So likewise, we have to arrange the slides so that it will be very much easier and simpler to understand. Now here what you can see all, it is also a self-explanatory slide. Now good mix of colors, if you will see in the left upper quadrant, it is readable. If you will see left lower quadrant, it is having good mix of colors, having good contrast, simple contrast, it is readable. Whether on the right side, if you will see, there is a bad mixing of color with no contrast at all, or the bright colors on the white. So it is all getting mismatched and giving trouble to the eyes also, and they are not clearly readable. So they are unreadable. So this type of small but important techniques and skills, being a teacher, we have to adapt and we have to focus more points in the bullet form rather than explaining them itself on the slide. So just make them on the bullets, highlight them and explain them in the classroom in front of the students, like I have shown in this slide. So left slide and right slide, two slides are there in front of you, for example. So more cluttered slide is on the left hand of yours, and the more neat and tidy slide is on the right hand of yours. So for self-explanatory, for example, some image is inserted in that slide, then that will be more attractive. So likewise, PowerPoint presentation you can have in your teaching, and this is more effective in your teaching method also. And this is also using various types of images. This is also having use of various types of charts. Also the animations. It is widely used in all types of seminars, training sessions, educational lectures. And this is using a software like Microsoft PowerPoint, where information is arranged in slides to explain a topic in a clear and attractive way. Now, what are the features of this PowerPoint presentation? So here the slide-based presentation are arranged in a what we can say orderly format. So we can have easy editing and customization in this. Then we can explain complex topic in a simple visual form. We can make classroom teaching more interactive with this PowerPoint presentation. We can support the lectures with the diagrams and videos, and we can help the students in project presentations as well. So it is very useful for online as well as offline teaching. So it will make learning more engaging, more effective. It will help students to understand concepts quickly through visuals and improve their attention and memory retention also. Now, few limitations also are there for this PowerPoint presentation, as it may require electricity and devices. It can cause over dependence on slides. If you will shortfall of electricity, then the slides will not be there in front of your eyes. Then that will cause the over dependence on the slides. It will need technical skills to prepare for the teachers. So many teachers, they don't know how to prepare good slides for the presentation or lectures. They may reduce face-to-face interaction if overused in a more manner. So in short, it is a powerful tool of teaching aid which enhances the education by, we can say, combining the text, visuals, and multimedia. And if it is used properly, it can make learning more effective, more organized, and more engaging. So here I have shown one example how the slide should be. The text should be very less. Diagram, if you will just insert one diagram for self-explanatory purpose, then the concept will be more clear to the learner or audience. Vice versa, if you will make a slide like this, just an explanation, crowdy words, cluttered slide. So that is text heavy slide with no accompanying visuals. So likewise, we can have number of differences in this, and we will have to sort with these differences. Then coming to the next point, where we can use the same font style, colors, and layout throughout, where we can maintain uniform headings and bullet styles, and just we have to follow a single theme or template. Whenever we are making any slide for this purpose, we have to take these points into consideration. Then there is a 6x6 rule that we have to have maximum 6 lines per slide. We have to have maximum 6 words per line in one slide. We have to use keywords instead of full sentences. So accordingly, we have to just use all these rules and regulations while preparing the PPTs. We have to just take into consideration a use of visuals. We have to use number of images, number of charts, number of graphs and diagrams in our PowerPoint presentation. We have to use visual improve understanding and memory. So that will be more clearly stating your ideas and getting the concepts to the students in a more clear format. We have to avoid irrelevant or decorative images in the PowerPoint presentation. And also, please use 2 to 3 main colors only in your slide, in your PowerPoint. Ensure the high contrast for readability. So if, as I told you, it is dark background, use light fonts. If it is light background, use dark fonts or dark texts. Just avoid bright or clashing colors to ensure that the concepts will be more clearly defined and explanatory. So proper use of animation is also important. Use simple animation, avoid excessive or distracting effects, keep transitions consistent. We have to follow the logical flow and organization as well. So we have to follow a proper sequence, like first point will be introduction, next point will be content, next point will be conclusion. So we have to follow the order, and with the proper order and sequence only we have to just prepare our presentation. Just use headings and subheadings clearly to make the concepts clear. Then just if you will see this audience-centered design, adapt the slides according to the audience level. What type of audience you have? If I am just teaching to the teachers, if I am teaching to the trainers, the quality of the slides will be different. If I am teaching to the medical students, the quality of slides will be different. If I am teaching to the common persons or layman's, the quality of slides will be different. So use simple language for students, consider the age, background and needs of the audience and keep them in a center and prepare accordingly. Then coming to the accuracy and relevance. So ensure the correct and updated information that you are having in your slide. It should be relevant and related with the concept and the subject given to you, which you are going to teach to the students. It should include only relevant content and please avoid unnecessary details. It should be very short and specific. Now coming to the smart board learning or interactive panel. It is very important and very interesting also. Many teachers from you must have all types of these interactive panels at your institutes now. So features of the smart board, we are just knowing that they are touch sensitive screen, they can display presentations, videos and images, they allow writing and drawing simultaneously digitally, they save notes for future use also. The internet connectivity for online learning will be very much beneficial for this smart panel, and interactive tools like Zoom, Highlight, Drag Drop will be can be effectively used on these interactive panels. Now, teaching with PowerPoint presentation, showing educational videos and animation. Now, these are the effective uses of the smart boards that we can use them effectively in the classrooms. So, we can draw the diagrams and explain the different types of concepts. We can conduct different type of quizzes and interactive activities. We can have online classes. We can conduct virtual teaching. So many type of advantages are there for these interactive panels. Likewise, we can have a use. Now coming to the most important LMS, that is learning management system. This is the one important point that we are all facing in QCI inspection by NCISM nowadays, whether that institute is having LMS or not. Now, a learning management system is a software platform which is used to plan, which is used to deliver, which is used to manage and track educational courses and training programs online. So, many LMS platforms are there which we can use. For example, Moodle platform is there, Google Classroom is there, Canvas LMS is there, Blackboard Learn is there. So many type of different LMS are there and you can have any one from them in your institution. You can design on your own also. And this is very much important that LMS is running very loudly nowadays in schools also, in junior colleges, in senior colleges, and now new education policy is telling us that we have to use it in the advanced education also. So in medical education also, the learning management system, it plays an effective role to manage, to deliver, and to track educational courses, various training programs. So you can create your online course management. You can upload your notes and videos and assignments on this LMS platform. You can conduct various types of quizzes and exams on this platform. We can track students' performance also in LMS. We can have communication tools like chats, forums, various types of announcements. If you want to put various types of notices on the notice board for the classroom number of students, you can have that advantage. Anytime, anywhere access is the most important feature of this LMS. So it definitely supports online blended learning. It helps teachers to manage classes digitally. It allows students to access learning materials anytime. It enables automated assessment and grading, we can say. And it can encourage the self-paced learning for the students as well. So LMS makes education more organized, more flexible, more accessible, and it connects the teachers and students beyond the classroom also and supports the continuous learning effectively. So one or two limitations also are there for LMS. I can just say that it requires internet and devices. It will need technical knowledge, no doubt. It can reduce direct face-to-face interaction, and also technical issues may be there which can disrupt the learning. So it is a powerful digital tool in modern education. It improves teaching efficiency and teaching learning experience by making education more structured, interactive, and accessible that we can see. So these are the various types of features of LMS that I have already quoted. For what purpose it is used: for course creation, for uploading notes, videos, online assignments, quizzes, communication, and for also conducting online classes, managing study materials, assignments, and students' performance as well. So coming to next type of teaching aid is e-learning or electronic learning. Now, e-learning is the use of electronic technologies and the internet to deliver education and training. So it will allow students to learn anytime, anywhere using digital devices. So many examples are there like Google Classroom, Zoom, Moodle, Coursera. Coursera, you must be knowing that it is a very widely used platform where we are using this for the electronic technologies learning method. So you can use all these techniques in this. And Coursera is very popular online platform that provides access to various types of courses, certificates, and degree programs also from top universities and companies around the world, if you must have heard. So Coursera offers learning in various fields such as computer sciences, business, data science, health, and personality development. So learners can study at their own pace through video lectures, quizzes, assignments, and peer discussions also. So key features for these types of software or popular platform is that many universities they will have this platform in a flexible and self-paced learning. The certificates upon courses implementation can be created in these platforms. Specialization and professional certificates can be created. Mobile app for learning anytime, anywhere can be created under this platform. So Coursera makes quality education accessible globally. It helps students, professional and job seekers upgrade their skills without needing to attend a physical classroom. It is especially useful for lifelong learning and career development. So these are different types of features of e-learning like digital study materials, online assessment, discussion forums can be created, chart progress tracking can be just managed with multimedia learning. Advantages also, it is very flexible, cost effective, self-paced, access to a wide range of courses, and it encourages digital skill. Now, when we use models, different types of charts in Ayurveda, it is very important that models and charts are important visual teaching aids. So, Ayurvedic teaching, if we are having models in 3D structures or the charts for diagrams and illustration purpose, they can be used very effectively to explain, for example, body structures, body or anatomy of different types of organs, diseases, herbs, or treatment principles in a clear and simplified way. So, demonstrating human anatomy, surgical procedures, panchakarma procedures, or providing hands-on learning experience, the models can be used effectively. Likewise, you can have different types of models depending on your topic and be related to your subject in your laboratory. So we are having UG and PG lab in new MSR for our UG and PG by NCSM. And there we are supposed to have these types of models and charts in our departments and in our departmental library, in our UG labs and PG labs. So use of charts also in Ayurveda teaching, they are playing a very important role. Charts are two-dimensional visual aids that present information using diagrams, pictures, or text. So they are explaining Tridosh theory. For example, they can show Samprapti, they can present classification of respective diseases. They can illustrate the treatment protocols or flow charts like I have shown in the slide. They can summarize the large information in a simple form, like we prepare in posters as well. So coming to the last point of this talk, artificial intelligence in teaching. This is very vast topic, and 5 to 10 minutes are not at all sufficient to explain this whole concept in a small time. So artificial intelligence is the ability of machines or softwares to simulate human intelligence, such as learning, reasoning, problem solving, and decision making. So AI helps teacher plan lessons, personalize learning, automate tasks, and improve student engagement as well. There are different types of AI in education where we can use. For example, intelligent tutoring systems. We can provide personalized guidance to the students using this ITS platform. We can have the use of chatbots and virtual assistants. You can create question paper, you can have the answer key, and if you have any query regarding any concept and if you ask to chatbot, the answer will be ready quickly and instantly in front of you. So it will also help for us to use the adaptive learning system in this AI. So we can adjust content based on students' performance. Few students are very slow learner students. So for slow learners or below average score students, we can have very simple and basic learning material that we can create using this AI technique, and accordingly just seeing the students performance, we can have the upgradation of the learning systems or learning materials as well. Then we can have automated grading system. Means evaluate assignments and tests. This is the automated grading system. Here in this slide it is shown, where the assignment submission, it is given to the students. He will solve. Then the plagiarism checker will be there. The plagiarism will be checked. That will just check his word limit also. Then the evaluation will be done and the automated feedback will be generated, just giving result to the final gradation and feedback report of the student. So this is how the automated grading system in AI we can use in the teaching aids also. Now coming to the AI content generator. So it will help create notes, it will help to create quizzes and presentations also. So this is very important platform for personalized learning, for virtual classrooms, for Ayurvedic diagnosis learning skills, for we can say intelligent search and research, where we can quickly assess the Ayurvedic texts, research papers, classical references in a simplified format in a second without wasting much of time. So this is how the students initiates the session. The AI tutor provides the guidance. Then the students, they receive the feedback and student continues learning. So AI tools for teaching, number of AI tools are there. ChatGPT, Google Gemini, Quizzes, Kahoot, Khan Academy, Canva, Kahoot. Number of tools are there where you can use, have a use of that. And please remember that it is personalized and efficient learning method. It is for the better visualization of all the systems and modalities in our medical education. So these are the advantages, and few of the limitations also for AI we can quote that it requires internet advanced technology. It may reduce traditional hands-on training if overused. It may cause the high cost of AI tools and systems, and it may need proper training for teachers and students as well. So these are advantages and disadvantages as I have quoted. Just have it in your mind. So to conclude with, education, media and teaching aids very important vital role in effective teaching and learning. They enhance understanding, retention and learner engagement by appealing to multiple senses. They, if we use it properly, the proper use of visual, audio visual, digital and activity based aids, they will cater to diverse learning styles. In today's technology driven era, educational aids help bridge the gap between theory and practice. So when selected and used appropriately, teaching aids make learning effective, interactive, meaningful and learner centered. So very important to conclude with, education, media and teaching aids play very important role in medical education. They make teaching more effective, interesting and student centered. And finally, we can say that teaching aids are not just supporting tools, but powerful instruments that the teachers will have in their hand, which transform the education into a more engaging and impactful experience. So, right media plus right method is equal to effective learning. So, thank you so much to all, and thank you all authorities for giving me the opportunity, and thank you all faculties for patient listening. Any questions, you are free to ask.
Thank you so much, ma'am. If anyone is having any query, you may raise your queries. You can raise your hand from React section. Shri Vidya, Dr. Shri Vidya, you can unmute yourself and raise your question.
Ma'am, good afternoon.
Good afternoon.
Madam, Pradya Madam, Dr. Pradya Madam, it was very nice presentation, so very detailed.
Thank you, madam.
I have only one question, ma'am. That is, this media or the use of e-tools, how to controlly use it now, because there are different kinds of students. Some students may require, as you had suggested in your presentation, the use of audiovisual tools, but how to use it in a controlled manner, and whether the advanced learners, we have three categories of students: average, above average and below average, no? So whether above average students can themselves be encouraged to create such presentations.
Yes, ma'am. This is very interesting and very important question. Thank you so much for asking it and elaborating on this point. See, controlling students' use of media and digital tools is less about strict restrictions. And now, हमारे घर में भी हमारे जब बच्चे मोबाइल का यूज इतना ज्यादा करते हैं, तो इट इज इन आवर हैंड टू मेक देम टू यूज देम इन अ लिमिटेड मैनर और इन अ रिस्ट्रिक्टेड फैशन, and more about guided use, boundaries and skill building. So if you only block access, you can have that type of limitation or facility in your hand or in your LMS system also, that you can block the access, or students will not often find that way open always. Then if you guide it properly, then they learn self control. Then self clear rules for purpose based use, we can say, like only for specific learning task. For example, you have given any research assignment, and or you can just have a use of Kahoot quiz, and if it is the lecture is over, then the Kahoot quiz will get closed. So this is how the student will not get addicted to use this media. Then the devices you can keep away when listening or discussing, so that the more we can say digital, what we can say, the contact will not be there with their eyes. Then use structured activities. We can use structured activities like give step-by-step task using digital tools. You can break the assignments into parts, or you can use guided worksheets or digital prompts also. Also, you can just do one thing. The teachers can use screen monitoring कि कितना घंटा स्क्रीन दिखा जा रहा है स्टूडेंट से. So you can just have that screen monitoring software for computer labs in your institutes. You can have learning platforms with activity tracking कि students actually क्या कर रहे हैं ये platform पे. तो वो activity आप track भी कर सकते हैं. Students, you can have the shared screens during instruction कि हर टाइम जो भी students देख रहा है वो आपके साथ भी share होगा and that will get saved in your portal. So this way you can just restrict. Another thing is the teachers, they will have to teach the students how to manage themselves, like time management, then turning off notifications, using focus mode or app blockers during the study. So that's how you can just avoid the distractions also while using these tools, and encourage the accountability in the students and not a fear for the electronic media. So instead of punishment, discuss the consequences of misuse with the students, with lost learning time or poor results. Like use reflective tasks, like how did media use affect your learning today. So likewise, you can encourage the students with the interaction, and you can involve students in setting rules. When students help create guidelines, they are more likely to follow the classroom agreement on device use. तो पहले आप classroom agreement उनसे just टिक करके ही आगे जा सकते हैं. So that way you can restrict the use. Peer monitoring or group responsibility system can be developed in your LMS, and balance restriction with engagement. If lessons are boring, students will escape to device. So use interactive media, make learning active and not passive. If you will just educate the students, then I think there will be no problem in using them. And advanced learners, yes, of course, this is a good point. If you will encourage them, they can create all these platforms on their own. They can effectively use these teaching tools, and they will also help you. You can also take the help of these advanced learners to teach the slow learners or the poor learners. तो जो भी कम एवरेज वाले बच्चे हैं उनको सिखाने के लिए थोड़ा प्रमोशन भी मिल जाएगा ये एडवांस लर्नर्स को आप अगर प्रमोट करोगे तो, एंड योर जॉब ऑल्सो विल बी मोर इजी टू टैकल विद देम. आई होप द कंसेप्ट इज क्लियर, मैडम.
Thank you so much, ma'am. If any further queries are there, you may raise your hand. If anyone is having any query, you may raise your hand and raise your query. Dr. Vanita Chogle, ma'am. You may unmute yourself.
हेलो मैम.
हेलो मैडम. यस.
हाँ, गुड इवनिंग मैम. थोड़ा आप वो सेल्फ डायरेक्टेड लर्निंग और ब्रेनस्टॉर्मिंग वगैरह जो अदर टीचिंग एड्स बताए ना, टीचिंग लर्निंग मेथड, उसके लिए थोड़ा गाइड करेंगे क्या आप? थोड़ा वो कैसे कंडक्ट करना है?
सेल्फ डायरेक्टेड लर्निंग एंड
वो बहुत सारे है ना. सेल्फ
ब्रेनस्टॉर्मिंग.
डायरेक्टेड
हाँ,
लर्निंग है, ब्रेनस्टॉर्मिंग है.
हाँ.
तो वो
Now there
टीचिंग
are
प्लान
number
में कैसे ऐड करना है और कंडक्ट कैसे करना है एक्चुअल में,
हाँ.
और
Now
उसको
there are
डॉक्यूमेंटेशन
number
कैसे बनाना है?
there are number of methods which can be explained and described, madam. The time is very short. If you permit, you can send your email ID, or we can just request NCSM to send your queries solved with all the proper answers to your mail ID. Now, self-directed learning is when students take responsibility for their own learning. So they will decide how to learn, what to learn, when to learn, and how to evaluate their progress. So the teacher acts more likely a guide or facilitator, not a teacher. He will be facilitator in self-directed learning. So key features we can see कि self-directed learning में the learner sets the goal. Students will decide कि मुझे क्या सीखना है, मुझे कब सीखना है. So use of books, internets, videos, e-tools can be taken into consideration in this. Self-assessment and reflection will be the most important part of this self-directed learning. And if we can just deal with the steps in this self-directed learning, first we have to identify learning needs. What do I need to learn? Second step is you have to set the goals. What will I achieve? Thirdly, you have to find proper resources, books, videos, online tools, and you have to learn and practice it again and again. You have to evaluate and regarding your understanding, whether you have understood the concept well or not. And again, you have to reflect, rethink on the same and improve yourself. So this is how the self-directed learning works. So for example, photosynthesis का एक concept है. So I will make students watch educational videos, then I will make them read textbook sections, then I will create a notes on that concept. Then I will tell them, or if I am a student, I will solve the quizzes which are getting created with the different types of AI platforms, and then I will summarize in my own words. So likewise, the self-directed learning can be done. Only the limitation which I can quote it here is, it will need strong motivation, madam. Not each and every student will go for self-directed learning. So we have to strongly motivate the students for self-directed learning. Secondly, some students may feel lost without guidance. तो teacher का guidance इसमें नहीं होने की वजह से many students, they may feel lost, and it requires good time management. So you have to encourage very strongly to the students for the same. And for the second point you raised, that is brainstorming learning method, it is a group learning technique. So when we teach in the classroom, take one concept related to your subject and go for the group discussion, and you can have this technique where students generate as many ideas as possible on the same topic without criticism or without any evaluation. Whatever they think, whatever they know, they will just keep on go on telling, and you will have to just listen to them. So it is a group-based activity. It is free flow of idea. It is encouragement to the students' thinking and thoughts, and no criticism at all in this. And it also encourages the creativity and active participation of the learners. So teachers give problem to the students, then the students share the ideas in the brainstorming, then all ideas are recorded on the board or on the digital tools. No judging during the idea storage, and later on ideas are discussed. Different types of ideas given by the students are grouped, and then they are refined. So likewise, brainstorming sessions are very important tool. They can be used during the lectures in classrooms. Also, they are having limitation. We can say they can become noisy or unorganized. बहुत मतलब शोर मचा सकते हैं स्टूडेंट्स क्लास में. Some students may dominate, or many ideas may lack depth if not refined later. किसी स्टूडेंट्स को कोई आइडिया भी क्लियर नहीं होगी. But each and every tool there, it is having its advantage and disadvantage, but these are various types of different methods that you can use, and whatever effective in your choice, in your ideas, in your convenient and convenient environment, you will have to adapt that.
Shall we
So
take
self,
another
yes
question?
sir, yes sir, yes sir.
Dr. Prakash. Dr. Prakash, you can unmute yourself and raise your query. Dr. Prakash Methi.
Good evening, respected ma'am. This is Dr. Prakash Meti from Sumanji Pairuz Medical College, Vadodara. Madam, I just wanted to know, are there any guidelines regarding the use of AI in teaching and assessment assessment methodology, madam?
Guidelines used in
Uh,
AI.
the guidelines as set by NCISM.
No, see, in syllabus, if you will see, the guidelines are not set, especially
Okay.
exclusively for the use of artificial intelligence tools in the syllabus in by NCSM. But if you will see overall guidelines, which are uh, set by the uh, this one information technology leaders, then there are different guidelines set in AI. You can just see that certain principles and rules are there which are used to develop or to deploy the use of artificial intelligence responsibly. For example, transparency should be there, then the fairness and bias control. AI should not discriminate based on gender, caste, religion, or background. The data used to train AI should be balanced and unbiased. Then privacy protection also is the main criteria and guideline that we can just have a look, that personal data may be protected. User information should not be shared without permission on this AI. And of course, safety and security. So AI should not cause harm to users or society, or systems must be protected from hacking and misuse. So number of guidelines have been already set on the Google or internet, and artificial intelligence is the powerful tool that we have to use in the medical education for facilitating the easy learning, easy teaching, and that accountability. For that accountability, we being a teacher are responsible for these tool decisions, and they are not just a machines, but they are powerful tools, and we are responsible for the control of these tools effectively. So reliability and accuracy, ethical use are very important while using these AI tools in the teaching.
That is okay, madam. My question is, can we get any guidelines from NCISM regarding these guides?
According to my knowledge, for artificial intelligence, up till now, the guidelines are not there. But if it is there, I can just share it with you on your mail. I will request NCSM to send you the same.
Yes, madam. Okay, thank you, madam.
Yeah.
Shall we wrap, ma'am?
Yes, yes.
I hand over the things to Dr. Tripti.
Thank you so much, ma'am, for enlightening us with the different teaching aids which can be used in our teaching methodologies, which can be adopted in teaching methodologies. Thank you so much, ma'am, Prajna Kapse, ma'am. So today we are at the end of this today's session, that is third and fourth session of day 2, 22/4/2026. So to the next, that is third day, that is the last day, tomorrow, 23rd, 23/4/2026, we'll be having another 2 sessions. So we will rejoin on 23rd, that is at 2 p.m. Thank you so much for all the participants who have participated in this. Thank you.
Thank you. Thank you all.
Thank you so much, everyone, for joining us today. These videos and live will be available on NCISM official YouTube channel. So you can go and visit our YouTube channel and subscribe to it. Thank you so much joining us today. Thank you. Thank you, everyone. We are ending this meeting here.